Red light. We're recording.
We're up.
We're here. We're here. Same place, different face.
Same place, different face.
We're here with the.
Man, you guys sound like sports commentators.
You know, life is a sport.
Yeah.
Like
everything, bump and grind. You handling your business.
Is it
a
marathon or is it?
Depends on the season.
Oh,
so you got off seasons, you got in game, you got postseason. So I think right now we kind of.
But if you ask someone from a different country, they'll say life is a marathon.
Life or age, place and age could play a role into it.
But if you ask the younger demographic, they'll say life is
quick sprint,
absolutely
40-yard dash,
right? And an older person will be like, "You fool, you just don't know."
Yeah,
we're making our rounds through the GRAAHI staff, and luckily enough,
yes,
we were able to squeeze a little bit of time out of Mr. Stacey's busy schedule, to be here. You
guys are making me sound very important, man.
You are, man.
You're a humble giant, as we call it in the office.
Yeah.
He's our anchor in the office.
Exactly.
That's a great compliment.
The program coordinator for Pathways.
Yeah.
Such an influential program that GRAAHI is piloting and running. A lot of good things to talk about in terms of Pathways and just kind of the influence that it's having.
Right.
And who better to explain the program than, Mr. Stacey himself. So without further ado, Stacey, if you don't mind describing a little bit about Pathways and just giving us an overview what the program is.
Sure. So as a Pathways program coordinator, I'm working primarily with Mikeisha Plesko, who is our director of education. And actually, to date, a year ago, came on board looking to utilize my gifts, if you will, my skill set when it comes to community work. That's pretty much my career. It's been in community. Particularly wanting to see how I can affect change in young men. And that morphed into just young people, period. Having grown up on the southwest side of Detroit, just looking at that community, being so much a part of that community, looking at my own growing up experience and development. Again, just determining how can I affect change during my time here on Earth.
Do you feel like
to be most impactful?
Not to cut you off,
sure.
But I'm sensing like, did you feel that you wanted to affect change positively, and at an early age?
We're
going to leave that.
Yeah.
Positively. At a younger age, was it something that you kind of knew, like from where you were living, seeing the things around you? Did you know, like, man, I want to have a role in kind of changing the things that I'm seeing around me?
No, because I think I was like every other young person, young African-American male. I just wanted to get out the hood, and really college wasn't necessarily, something that was in view. It's really, I want to make money.
Right.
And I don't mean illegally. I mean, I
just in general.
In general, right?
Yeah, you want to get your own bag.
Right, absolutely. And so I think it would have been helpful had I had parents who went to college and had that background, because I think it would have been easier to navigate because I had seen it done. Because I didn't, it was new. A new trajectory, a new navigation, and again, once I got to high school and sort of toward my senior year, I started hearing more and more about where you're going to go to college. And I kind of picked up the answer that other students were throwing out.
Whatever your boys and your homies said, like, I'm about to go be in communications.
Right. And you might not know what communications is,
what
right?
it entails, right?
And you're like, I want to do, again, what everybody else is doing. And it wasn't until I actually, graduated high school, got accepted to a couple of colleges, entered into college in Tennessee, and I began to, I guess, see what had been talked about, getting an education, but allowing that education to really create a pathway for you, right?
Right.
And not really knowing what I wanted to do with my life at the time, right? Again, I wish that I would have had more questions, a little bit more direction when it came to what I was passionate about. Yeah. Because as an adult, not having that information, not having that kind of direction, you're just an adult still trying to figure out what you want to do with your life.
Truly.
Right.
And so it was not until just years after going to college that I began to really take into consideration some areas of work that I would like to see myself in. Mm-hmm. Interestingly enough, while I was in college in Tennessee, I actually worked in a tutoring program as a college student, right? Not knowing that roughly 20-some years ago, I'd find myself utilizing those skills that I learned now, or in the variety of capacities I've been in now.
Exactly.
Even when it comes to pathways. Right. Again, pathways, I'm working with youth. I'm working with elementary, middle school, high school, and college students.
Right.
20 years ago, I was walking down the street from the HBCU that I was going or attending, interacting with elementary age students, tutoring math, tutoring science, not knowing the impact that would have.
What's that, foreshadowing almost in your own life?
Sure.
Like it's giving you a taste of, and I say this, I probably said it in the last episode, divine timing. I'm going to keep bringing that up for everybody because every moment is divine timing. We have the opportunity to do something outside of serving yourself. I believe you should seek to get as much from it as possible.
Absolutely.
Because you're going to learn a lot about yourself if you push yourself in those moments. But then on the back end, you're getting prepped for when that preparation meets opportunity type situation, right?
No, and it's crazy.
So it's good that you brought that up, right?
No, it's crazy too, because like as you prep in your youth through your education and all that stuff, you don't even know what you're prepping for sometimes. You're just kind of like building yourself up to see, what the opportunities will be. So
exactly.
One of the things that I think is interesting, man, is I think you have a lot of young people, and I've actually told young people this just recently. You have a lot of young people who are passionate about people.
100%.
And they're passionate about people because grandmama and them, live with them, so they're around it, right? Or they are part of a church community, or they're part of some kind of community resource center. But they're passionate about people, like they engage people, right? And sometimes there is a disconnect with being passionate about people and the education or the academics.
Right.
And how do you marry the two? How do you help young people take their passion and marry that with their academics? Because that's the thing that's going to drive them into some kind of successful future.
Right.
I was passionate about people, right? Yeah. I just wanted to help people. Was I a straight A student? Sure, I did. I made the grade. When I graduated high school.
Let me tell you something.
I thought you were going to say no.
People follow up with the sure piece.
Yeah. I thought you were for sure going to say
I thought you were going to be like, I
graduated.
had some C's.
No.
He said no.
I did. I actually had some
barely,
C's.
which is good though.
I graduated high school with a 3.2 grade point average. In the 6th grade, I failed all my classes.
What was going on then, Stacey?
So, there was a lot of
life.
Traumatizing family dynamics happening.
Right.
I just couldn't focus. Right. That didn't mean I wasn't a smart student. Just at that moment, I couldn't focus. Right. And if I let you in, mom and dad were getting a divorce. That affected how I look. My outlook.
Right.
School. Anything. But I graduated with 3.2 grade point average.
Still made it happen.
Solid.
9th grade, I got kicked out of high school.
Yep. I've been in that.
Spent 4 months at home waiting for a trial, waiting for these, at the time, school administration to let me know
what
school I was going to, they were going to allow me back into if I were going to go back to high school.
Right.
But I didn't have to repeat neither one of those grades. And I graduated with 3.2 grade point average. Why am I saying that? Because I think there are moments that happen in life that some people would actually just, cast him out or cast her out, right? but those can be just seasonal moments.
Yeah.
Seasonal moments that produced, a very trying time for an individual.
True. But now, with your Pathways program, can you talk about the disparity that we kind of have noticed to where now we're creating this program that you're running right now alongside with Keisha, and why it's so important to have this Pathways program?
Man, it on so many levels, it's super important to have pathways when it comes to the demographics, or shall I say the data in the healthcare field. Students of color are drastically underrepresented when it comes to healthcare fields. When you look at data, interestingly enough, I just sent an email to someone who wants to do a report on what we're doing, and I just shared with them that from 2017 to presently, studies show that 64% of U.S. medical workers or the U.S. medical workforce are white.
Say the number again.
64%.
It's over half.
Over 64%.
It's huge.
Compared to 16%, which is representative of Hispanics. 11%, a little over 11% of blacks. 5% Asian, and then you have a very small percentage of other, if you will. There's such a drastic difference between, who's seeing certain patients in the medical office. And so for us, our hope really is to go into the local school, create opportunities where students can see healthcare professionals who look like them in those kinds of roles. And when I say in those kinds of roles, outside of the physician or the nurse or the dentist, we know that they have somewhat of an idea when it comes to nurse, because there's a school nurse, and perhaps they are going to the nurse regularly to get a shot or checkup or what have you. They see the provider or doctor, again, for
some of the most
reasons.
commonly known stuff.
Absolutely.
That, I guess everyone at this point would know about.
Absolutely.
Just in general. Nothing outside of that.
But do they know what an occupational therapist is?
Right.
Yeah.
Do they know what a phlebotomist is? Now, interestingly enough, a phlebotomist does some of the work that the nurse does, or vice versa. But they might not know it under that term, right? And so for us, it's how do we help them or broaden their understanding when it comes to other professions. But again, to see them in the classroom who look like them, sharing their journey. But if I'll say this, there are three things that we really want to do in that process. Our hope is to expose students, bring awareness to, again, the varying occupations that are out there, but create a pipeline that'll help them, diffuse barriers that they may face, gain support, whether it be financial support, emotional support, educational support, what have you, so that they can find themselves on that trajectory as well.
That's dope. I ain't gonna lie. That's dope, because I grew up thinking I was gonna be a nurse my whole life, and a physical therapist. That's because I was going to physical therapy with football and stuff. So that's what I was exposed to.
Sure.
Right? So I just thought it was all glitz and glamour. I'm not gonna lie to you. Then I graduated high school, was in the Navy, got out, and I went to school to be a patient care technician, which is an equivalent of a CNA. So I was working under nurses in the hospital for an internship, right? Which a lot of those programs don't have internships. But I was in there, and I was seeing the caseloads and the treatment plans and the hours that these nurses are working.
It's crazy.
And I said, it ain't for me.
Sure.
But right before that, I was looking at nursing schools. You know what I'm saying? So I actually got a chance to sit in with Stacey on a couple of these where he brings in these professionals. And I think it's dope because they get to see and actually talk to this professional and in their setting. It's not like they're going out to a hospital or having to leave. They're coming to their home or their school and speaking with them, and getting to ask all the questions that they want.
Absolutely. And I think that's key.
That's the best
key.
thing.
Truly.
Kids, adults, doesn't matter. You don't go to the doctor's office and begin asking the doctor,
Yeah,
hey, what is that tool for?
Right.
Yeah, exactly.
They don't have that much. They don't have enough time to right.
to tell
But
you.
here, it's they come to their space, and I tell students, no question is a stupid question.
It really is.
Right. They're able to ask, the most intriguing questions, right? But it's broadening their understanding, whether they, they wouldn't otherwise have that opportunity.
Right.
Here's another piece that I really I enjoy, that I believe highlights particularly our elementary portion of Pathways, is we are working in conjunction with Sylvan Learning. So Sylvan Learning, if you don't know, Sylvan Learning is a tutoring agency, regional here in Michigan, that comes into with us, working with us. They come into the school with us on the same day, but they do have their own office where students can actually go and get a variety of tutoring services.
Right.
But we bring Sylvan Learning in, and right now we're working with students in the areas of reading, literacy, and math. Now, there are a number of other subject matter that they can actually work. Yes, but we are particularly working with reading, literacy, and math. Why? Because what we've learned is that math, there's a great deal of problem solving in math. There's a great deal of comprehension, especially when you begin to work through math word problems.
Word problems, yeah.
Yep.
The reading literacy piece helps students attain grade level reading literacy. And so they're working through comprehension.
Critical thinking, skills,
yes.
all those kind of intangibles as
yes,
well.
when it comes to grammar and syntax and just word order, all of those things, right? And so the reason I bring that up is because it doesn't make sense for us as a program to speak to students about healthcare if they haven't mastered
some of the
other critical
pieces to
subject matter that absolutely
to that point. So I mean, so what you're saying is that you're coming in, bringing in health professionals. So also looking at some of the layers, you'll know what the day-to-day tasks are for this job. You'll kind of know what you like and what you don't like. But then you guys already know some of the critical skills that it's going to take to get to any one of these jobs. Exactly. And you guys are bringing in support from professionals or people that's been doing this for a long time and getting them to the kids.
Absolutely.
So they're learning, getting tutoring, and exposure.
Yes.
All under Pathways.
Absolutely.
At an elementary level.
At an elementary level.
That's powerful.
It's amazing. We operate under the pillars, care,
right?
Community, advocacy, research, and education. And to be honest with you, Pathways seems like the picture perfect mold.
I'm glad you said that, because
Cal.
that was what I was going to say. I mean, there is a community aspect to what we do. I mean, we're intentional with where we go and where we're placing our time. And who our audience is, our targeted audience. There is the advocacy piece. We do, even at this stage, we do want our students to learn how to advocate for themselves, right? Yeah. I remember we had you come in, Kaylon, and perform phlebotomy simulation for students.
That was fun. That was super fun.
One of the things that students, they talk about it today, but one of the things that one of the takeaways was students being able to go into the doctor's office and determine and share with the nurse which arm they wanted to have, their shot taken in, right?
Right.
We don't know. That's something very small and minute, right? But it's teaching students how to advocate for themselves,
right?
In a tactful, respectful way.
Yeah, the small things. I didn't even realize that. Like something as little as which arm.
Yes. Can you stick me in my left? And you know why you're asking.
Absolutely.
These like education behind
awesome.
it.
Right.
It is so powerful, and it builds a sense of like independency, which builds a little bit of pride.
And there's empowerment. Right? There's empowerment. There.
It really does.
That's the word.
There.
Yeah.
And then there's the research piece. I mean, again, there's data that goes along with the work that we're doing. Wanting to make sure that we conduct surveys. Again, take the data that we come in with, the leading questions. What do you know about healthcare? What do you know? What would you like to know? And then at the end of our program, come back with those same questions. What did you learn? What were your takeaways? And utilize that data, whether it be it's for funding or whatnot. And again, I think that's a part of the systems level.
Right.
The process, again, I think we talked through it was here we're working with Sylvan Learning, and that process, recognizing what students need, giving that to them from a support standpoint, but also sharing this health piece because there is the educational aspect of things, right? And then, again, allowing that to determine how do we continue to move forward when it comes to the sustainability of pathways. Last year, we came in sort of the latter part of the school year, and so we only had 10 weeks.
Okay.
And so in the 10-week program, our students rose reading level 30-40% in only 10 weeks.
That man said 30 to 40%.
But here is the key. The key was consistency. We were seeing the same kids every week. Even though they drug some of the students, they drug their feet, oh, I don't want to do this, right? We encouraged them.
He said the good old after school program until they get in there.
Right.
Then they rocking and rolling.
Yeah, they drug their feet. But again, and there's a reward system, whether it be behavior, attendance, that sort of thing. Again, it was really something used to engage them, but to keep them engaged, right? But we knew and we know that the consistency of kids coming is the thing that drove the increase in terms of reading level. And some students come in 1, 2, 3 grades behind.
Yeah.
And I think what people don't realize is how much more work that is, or how much more of a workload that is for a teacher. I mean, particularly you have a teacher who has between 20 and 30 students, but they're all at different grade levels. They're all in the 3rd grade, but they're all at different developmental levels academically. And so that teacher, he has to maneuver, their teaching methodology in order to accommodate all those students.
Right.
Pathways is designed to walk alongside the teacher. It's to really help. How do we help the teacher be successful in her workspace? But also, how do we help students rise to a level that not only are they meeting their academic standards, but again, there's this health focus, this health piece that is attached to it.
Being reinforced. That's amazing work. The 30 to 40% growth goes into a testament of the Pathways program that's been curated, well thought out. So kudos to everybody that's involved in that program and working on that.
And I'd have to say, I mean, a great deal of that, is the direction of Mykesha.
Yeah,
just really coming behind what she's attempting to do, moving past barriers that are in front of whether it be elementary students, middle school, high school, college students. We're really looking at how do we galvanize other community agencies and partners, local hospitals, local colleges, with one goal in mind. And that one goal being, how do we together help students become successple?
Gotcha.
And utilizing our areas of expertise to get it to that end.
Gotcha. What schools are you guys, for people that may be watching right now and they're probably, interested in this program, want their child to be exposed to it or be a part of it? What schools are you guys in right now? And kind of what's the plan as far as trajectory or where you guys are heading with, like, how many schools would you like to be in?
Right. Right now we are in Stocking Elementary, Ottawa Hills High School, and UPrep Middle and High School right now. We are in conversation to get into the Kentwood schools. We've had conversation with Brookwood. So we're really looking to expand and get into some of those schools as well. But we also want to generate some hard data as well, because we know that having the hard data brings a great deal of credibility to the work that we're doing. And that just, again, allows the door to be open that much wider for us. Colleges, we are working right now piloting 5 schools. So GRCC, Davenport University, Fair State University, GVSU, and MSU. And so we have a variety of students in those schools right now. Again, when it comes to pathways, on the college level and the elementary level, it's different.
It is.
Because there are different needs. Again, so we are, again, trying to address the needs academically when it comes to elementary, and that's where Sylvan Learning comes in. With middle school and high school, we are specifically reinforcing opportunity for students to engage professionals, but also visit some of their campuses as well. We just had a previous field trip where we took high school students to Life EMS, so they got an opportunity to tour their campus, to see some of what happens there in their workspace. Then we previously took students to GRCC, and so they were able to tour their dental lab, see what happens on the dental floor.
That's amazing.
But also talk with professors and their workforce there to see exactly what goes into dental practice, right? And so we had Kent County dietitians, registered dietitians. They came in to our middle and high school and talked through their area of expertise, particularly when it came to the WIC department or the WIC program. Some of the dietitians work primarily with infants and women and the children grade going up to the age 5. And so they were able to hear the difference between a nutritionist and a dietitian, right?
Which to this day I sometimes get. But there is a difference.
There
and those
is.
are two
There's a huge
different
difference.
separate careers.
Absolutely.
huge difference.
Absolutely. And
So
students walk away, again, they walk away with a great deal of information.
Awesome.
We hope that they share, lots of content. And then, again, really give them their journey. How did they get to where they are? But then leave them with some simulated activity that allows them to really taste, touch, and feel the work.
Bringing it directly to the students.
Absolutely.
Is awesome.
Absolutely.
No, and I wanted to take the time to read this directly off the sheet. Pathways relates to the community by investing in students. We are invested in the family units, as Pathway students will be leaders in healthcare and be able to address healthcare disparities, which helps the community today and generations to come. I thought that was beautifully written. And at the end of the day, a great representation of what, Pathways is as a whole. I wanted to dive into a little bit of, I know we spoke about some prospective schools and locations that we were looking to be in, but what are some overall goals for the program in 2023?
2023. Well, we'd like to be in more schools. Again, right now we're just in 3. But we would love to be in 2 more schools.
Okay.
I mean, as you all would know, that takes a little bit more support. So because the workload would increase. But I'd love to have more students visit more colleges and simulated labs.
Okay. Gotcha.
I would love that, because there's nothing more to this than students' eyes lighting up when they actually see these kinds of things in
sparking that
practice.
interest.
Right. I was going to say, what's some of the testimonials or what's some of the things that the kids have kind of came to you, like starting the program? I know they probably dragging their feet, but afterwards, I've seen the smiles and they faces lighting up. You know what I mean? What's some of the things that you kind of heard that reinsures the work that you're doing and makes you feel good about the work that you're doing?
So we had an elementary young man. Again, kids say the darndest things, right?
Elementary.
We took them had an ambulance actually come on campus there to their school, And so they got an opportunity to go into the ambulance, and one of the kids says, "Oh, Mr. Stacey, even if I was knocked out, this would still be awesome." And we did. We laughed, man. I mean, as an adult, you're like, I don't know if this would be cool if I was knocked out, right?
This is funny, but that exposure, he might be saving our lives.
Absolutely right.
God forbid, but he may be, be looking at him like, boy, we so happy that you made it out to that EMS.
Right.
Oh, man.
The other, and again, on a more serious note, we took some middle school, high school students to Life EMS, to their campus. And we were able to be in their dispatch center or department. Okay. So this was, dispatch center is just the area where they're taking all the calls.
Calls
right?
come in and they triage them out to where they. Okay.
Absolutely, and we were able to listen in on a call of one of the workers helping someone who had called in perform CPR on someone.
Oh, wow.
And so this was happening in real time, right? And so in the end, when we got ready to leave, I always ask a question: what are your takeaways, or what is your takeaway? And so we had two students say, you know what, I think I want to work in the dispatch center.
Really? They really said that?
Yeah, they did.
I'm not surprised. I'm more so just like excited to just hear that, like for them to just to say it like organically.
Yeah, and again,
that means a lot for them,
right? But had we not had that, expose them to that experience, that might not be something that they would be thinking about.
True.
Or they wouldn't see, this is what goes on in the dispatch center, right? And so not only did they say, hey, this is what I'd like to do. I think this is what I want to consider. But we also have a program, or Life EMS has a program that allows students to participate and become an EMT, and they'll pay for it. And then if they want to become a paramedic, they'll pay for that as well. And so there are scholarships that are offered to students for them to actually be a part of that team, get the education behind them. So again, a barrier for some students might be financial. Well, that financial piece there has been alleviated.
Yep,
right,
100%.
Again, but if they're not exposed to these things, that might not be something that they would be thinking about.
Right.
Again, you hear some of those stories. I mean, we had a wound nurse come in and show students just, again, all of the ins and outs of their job.
Yeah, dressings and
absolutely.
Did she come in with pictures and things like that too?
She did.
Came in. Okay, what grade was this?
This was high school.
High school. Okay, so they could take a little bit more. Yeah.
Yeah. And again, in the end, hey, what are your takeaways? And one of the students said to me, Mr. Stacey, I'd love for the wound nurse who came in, I'd love for her to be my mentor.
Really?
And again, these things they're not prompted.
No.
Right? Yeah. These things are,
for a kid to say, I want a mentor.
They're having aha moments.
You're starting to see these kids advocate for themselves.
That's right.
That's right.
And stand up and say, this is what I want.
Coming up out of their own comfort zone, being open to advocating for themselves, like getting those questions out, saying, hey, I want a mentor, or hey, this job really intrigues me. Like, that's just beautiful to see the work, come through to the end.
To full life.
To fruition.
Yep.
Absolutely.
Yep. Yeah. I look at y'all programs like a pebble being thrown in the ocean and then it's a tsunami years down the line. And the tsunami is a flood of diverse faces entering into these professions. And that's really, really important because it builds community. For you to be exposed to a dispatcher, right? You need dispatchers.
Yeah.
Right.
And EMS.
Exactly.
Right? Like you need the CNA nurses, the phlebotomy team. You need all those components for the system to run.
Right. Exactly.
But if everybody's just focused on being a doctor, the table will be a little heavy on one side.
Well, two things that I think are key and helpful for students is, understanding the pay. Again, at the end of the day, no one wants to work for free, and that's so huge. helping them understand the pay range in some of these occupations, right? And also to letting them know that pay is not everything, right? It's not the end all be all. but that's a part of it. And to really be honest with the pay, and some of them being just shocked with the pay of some of the professions that we bring in. But I think the other thing that students walk away with is just the level of people engagement. And again, I talked earlier about just being passionate about people. And I think that is the one thing that they really want to engage. And perhaps maybe to get paid as a byproduct of that.
I mean, definitely want to get paid. You're right. But I mean, to have that personal fulfillment and to know that you like what you're doing is one thing.
Absolutely.
That's a whole nother thing, right? To know that you like doing what you're doing and the personal fulfillment and impact.
I didn't tell you all this, but when we were at Life EMS, one of the young ladies who works in the mobility department, I saw her at a glance. I didn't recognize that she was one of my youth over 10 years ago.
Oh, wow.
And so
That's a full circle
here
moment,
is a
dude.
moment
That's
for
crazy.
me to see someone who perhaps I had impact or influence or engagement with over 10, 15 years ago. And this is what she's now doing as an adult. That's the impact. Again, many more things, but that's one of the
powerful.
impact.
Yeah, it is.
That's
It is.
powerful.
It's awesome that he's our
Yeah.
coworker.
Yeah,
you
that's
know?
why I
Like,
say he's the anchor in the office.
Yeah.
You could tell. I ain't gonna lie, Stacey's a smooth operator when it comes to just making sure your day just goes smooth, right? You could be dealing with the most craziest thing in the world. Stacey gonna come slide past your desk and check on you. He may drop some nice cologne on you to try out, right? Yeah, he might drop some Derek Collins cologne on you.
It's just a Tuesday for
Make
him,
sure you're
man. It's just
smelling
a
good as a young man, right? Which I'm appreciative of.
He's like, Kaylon, come here.
Come on over
I
here
got
real
you, son. I
quick.
got
Let
you,
me,
son.
let me have you dabble in this.
He's been a direct beneficiary, huh?
Direct beneficiary. I tell you, now you talking about impact.
Yeah, for real. Let's talk about
impact.
some real
That's
impact
made some
here.
impact in my
That's
life.
funny.
So I
That's
appreciate you.
funny. Man, I appreciate that. That's
Same.
good to hear.
Yep. And who he's working alongside with, Keisha, she's also she's a person that is a selfless individual.
Yeah.
Anybody who's interacted with Keisha, she will go above and beyond to do what needs to be done to keep the needle moving forward.
That's right.
She's a true visionary, in my opinion.
Truly.
I don't know how she does some of the things she does, but she gets it done.
Yeah.
And at a very high level, but can connect to everybody under. And to have that ability is a gift. And I have to recognize that gift that she has, because no matter who's in the room, she's able to, I'm going to take your word to use her, to galvanize everybody's ideas, opinions, and kind of sit on it and execute on what's best. I mean, all of us have interacted with her, right?
Of course.
So I know, and stop me if I'm saying anything wrong, but she's a true selfless person.
Yeah.
So for her to be working alongside of you and impacting these kids, I know that they're getting great community leaders.
They are. They are.
So that's what I gotta say.
Ditto to all you just said.
Same. I was
Again,
gonna say
think
she's
it's
just
great.
She's a leader that you just trust.
Yeah.
You know, you trust in her vision, you trust in her word,
Trust her
you
with
trust her.
everything.
Everything. You
I
know
promise
darn
you
well.
that.
You know darn well whatever she says is the
It's a
best.
go.
It's the best. It's the best option. Let's go with that
Even
one.
for
Plan
you,
A.
you'd be like, oh, I should probably know this for myself.
Yeah.
But she'd be like, no, just do this. You'd be like, man,
why did I not even look at
I
it
didn't,
that
I
way?
didn't think
Wow.
about that.
Yeah.
Appreciate you. I feel
another
like I should just
perspective.
be paying her. She's working pro bono, like
Yeah.
therapy, like for everything, financial
For real.
management. But
She's awesome.
It's good to have someone who has those characteristics and skill sets.
it's amazing, man.
Yep.
I can't. I'm so happy we brought you on so you could talk about pathways.
Absolutely.
Talk about you. So the
Sure,
people get to
sure.
know you.
Yeah.
I wish we had more time.
I know, for real.
I wish
For
we had
real.
more time with him. But yeah, my closing remarks are just kind of what I said, and the groundwork is being laid. There's a lot of good work that's been going on, but I can tell with you and Keisha that there's a lot more work to do.
There
and
is.
You guys aren't finished yet.
Yep. No, we are grateful for the work that we're doing and the impact that we're making, however small. Again, I think, sometimes we think we have to make large impact, right? Like we have to, every student is going to, soar. And again, I don't mean it in a crass way. They will. But we also operate under the mantra that if we could really impact one student and that one student soars, then we've done our job.
Yeah, seriously.
We've done our job.
I agree.
It's like just the ability for students to have access.
Absolutely.
Whatever they decide to do with the information and the resources and the education that was provided to them, solely up to them.
Yeah, they need to get it first.
Yeah,
right?
exactly. But you need to have access to it all.
True.
So just the fact that you guys are there for them and the program is even established. I mean, where they go to school every day. You know, it's a place they'll go to school Monday through Friday. They will be there. So it's awesome. It's awesome. We're bringing it all to them.
Let's get to some of the.
Let's do some funny stuff.
We got some funny stuff.
Oh wow!
Call it funny stuff.
Funny stuff.
Like
Funny
that title?
portion.
I
feel like
know.
it's a little mysterious.
Oh, it very because I don't know what
You don't know
getting
what's
ready to
funny,
get myself
right?
into.
Some things ain't funny. Some things ain't funny.
Right.
But these gonna be funny.
All right.
Cal, give it to him.
I think we should switch up the questions from yesterday.
Go ahead.
So the first one,
You got it, boss.
office comedian. Who's the
Office comedian.
Yep. Who's the jokester of the office?
I don't know if I can say one person because I think we all.
If you want to bend the rules, go ahead, Stacey.
Well, no.
I'm just playing.
I think we all have jokes.
We're
I
all
do.
pretty
I
hilarious.
think, and I think we feed off of that. Like, once you get in here in the morning and one person says something,
Yeah, everybody start coming out the office.
Right? Yeah,
Office like
right.
Everyone, is this time?
Absolutely.
Everybody off their meetings.
Right.
All right, let's go.
And you have that you have opportunities sort of gang up. Sort of right by Ashley's office.
Yep.
That's what
You
I
see
think.
someone leaning on the wall.
Right.
You're like, yeah.
And they see, everybody holding their stomachs, tears coming out.
Right.
Everybody saying, all right, get away.
And it all happens in that 20, 30-minute period. And then everybody disperses to go back to the
back to work.
Right. So I don't know if it's one person necessarily. But I think it's a combination of everyone. Again, just feeding off.
I like that answer. I like that answer.
Me too.
We'll go with the same one as yesterday just to keep at least one thing consistent.
Okay.
Best dressed in the office.
I think Miguel has it hands down.
Okay.
That's what I was going to think too. Miguel
He always looks dapper.
He puts in the effort.
He always looks dapper.
And that you got to respect that, don't you?
Yeah,
Whether it be like the cardigan that might be one or two sizes too small.
The sweaters.
Yeah.
The man's got sweaters.
Yeah.
You know what I'm saying?
The best
That's
time
grown
to
man.
wear a striped sweater.
I think
It's all the time.
It's all the time. That's why when he rides in the
That's
workout.
his alarm clock in the morning. Gets him up.
interesting. Just this. I just learned. I'm very observant.
Yeah.
I'm very observant. I people watch, right?
Yeah.
And I watch like just his style. Like, he'll pair two different types of styles together, right?
Mm-hmm.
He'll walk in with a suit and some gym shoes and a skull cap,
And a skull
Yeah.
cap. Clean.
Yeah, but
I
looks
call him
looks-
clean bean.
right? And I'm like,
clean
How?
bean.
how does that work? But I'm digging it.
But
right?
I'm starting to like
Yeah,
it. I'm
I'm
trying to
digging
figure
it.
out what
It's
I
like
can
it shouldn't.
do.
It shouldn't work. It shouldn't work, but it does.
right?
Yeah,
He's
you
giving me
know, teach
ideas.
me something
right?
here.
Right.
Yeah.
So I
you that.
think he is. He's the
Best dress.
Shout out to Miguel, the style bender.
Right.
Yes,
We'll give him
sir.
that.
The style bender.
Guys, versatile.
All right.
And last one, not really even funny, but
No.
just feel good.
Yeah.
We'll end it off with a heartwarming
Wholesome.
moment.
Okay.
If you don't mind giving a random affirmation to a staff member.
Yeah.
If I don't mind, who would that be and what would it be? I enjoy the group that I work with. I do. And so, just shout out to everyone who works for GRAAHI because I think we all bring something of value to the table, right? I do. One of the things that I do like about Kaylon is just his ability to get things done. But yet there is this relaxed personality that he has. I love that. I love that I get opportunity to to interact with that on a daily basis. Again, it's this professionalism that he has, again, to address tasks that are in front of him, but then also to those moments when he can let his hair down.
The locks be flowing.
The locks be flowing.
I can't necessarily say that about myself. I can't let my hair down. But
now you're going little. You got to relax.
You all call this the funny moment.
Yeah, there we go.
Hey, when the last time you let your hair down, Stacey?
I tried to do it yesterday.
I'll grabs for it.
The wind didn't hit it in the right way.
Did you bring your hat up here?
No, I
bring your
should
hat.
have. I should have. Yeah.
There you go.
So here's the thing.
whole hairdo.
They, I had to let them know that when you don't have hair, it means a lot, because you don't realize how having hair.
No, this is an emotional time right now.
Having
you about to drop a tear on us.
actually, it benefits you, right?
Okay.
You don't realize how cold it is out there when you don't have
truly.
that on the top, right?
It's unlimited wisdom.
Stacey's our temperature gauge.
I'm just trying to.
He knows
It's
the
cold out.
exact temp,
Put a coat on,
man.
please.
When that wind hit that, it goes just
It's
like that. He say, man, it's about 66 degrees.
I'm gonna tell you. I'm gonna tell
Come
you
with specific numbers.
I'm
love
gonna tell you how you can relate to this.
Okay, talk to me.
Have you ever fallen in the winter?
I have,
yeah.
unfortunately.
Oh yeah.
That Meek Mill fall down the steps.
Oh god.
Everybody sees that meme? Look it up.
When you fall in the winter, I don't know why or how, it seems colder when you land down on the ground. I don't know how. It seems colder, right? It seems so cold, man, that you can't get up right away. You can't get up right away. I'm serious. I can say this because it's by experience.
Your bones be froze. Hey.
Look, and you lay there for you lay there for a little longer than you would if it was in the summertime, let's say, right? That's how my head feels
all the time
in the winter.
Hey,
with no hat.
Stacey not moving without that hat.
No.
I wish he brought it with him, but if you seen that hat, you know it's Stacey.
Just one of the guys. I
head down.
Absolutely.
Hey, the bill is always going against the wind, baby.
Yeah.
It's functional, man.
It's all protected.
It's functional.
All
right.
Right.
It's functional.
All right, y'all got me in tears.
Here we are.
This is us all day, though.
Yeah, man. This is the dynamics of our team here, man.
100%.
We have a lot of fun. We work hard. We are serving the community.
Yep.
And we're looking good while we're doing it. So
yeah,
absolutely.
Again, Stacey Baker, program coordinator for Pathways, a very influential, beautiful, inspirational, passionate program that GRAAHI is piloting.
100%.
And we look forward to seeing what the future has with Pathways as employees, but also as just community members. You know, us being members of the community, I feel like we tend to forget that sometimes just because we're working so closely in the healthcare industry that we ourselves are community members, and the impact that we want to see and we love to see is something we're working on here every day, and something that everybody is working on together. So. Again, beautiful segment. Thank you so much for being here with us.
Absolutely.
It's not like you really had a choice, but
100%. We appreciate you. Hey, Mike Keisha.
Yes,
thanks,
sir.
Mike Keisha. Yeah, and bada bing, bada boom.
That's a wrap.
Pew, pew, pew. All right, live mics. We sound good. We look better. How's everyone doing today?
Good.
Wonderful.
Wonderful.
But yeah, today's a day with the home team, so I'm happy about that.
Yeah, this is a special episode today because these are the people that we work, even though we work so closely with everyone here at our organization. These are the people we definitely see the most, work with the most, and engage with the most. The Heist team. What does Heist stand for?
Healthcare.
You're wrong. Ashlie, what does Heist team stand for?
So what he doesn't know is it's
Keep
going to be
it.
on his review.
Keep it. I don't focus on titles, man.
We're only a department. That's
I
all.
don't focus on titles.
So luckily we don't have the sound.
I go where I'm
effects.
told.
Yeah.
Health initiatives, community engagement.
There it is. Ding, ding, ding.
Just
ding,
in
ding,
case
ding,
you didn't
ding, ding.
know.
You heard it here. Health initiatives and community engagement team. So that's what we do. We are the Heist team, consisting of 5 total. Obviously, if your eyes aren't fooling you, we have 4 here. My name is Calvin.
My name is Kaylon Shackelford.
Virginia Walton.
And I am Ashlie Jones, and we're missing Darcy King. Darcy, we miss you. We hope that you feel better soon.
Yes, we do.
It's flu season. It's sickness season. Some may say it's just you're catching bugs. They're flying left and right. Make sure you're staying safe, staying inside, staying warm.
Exactly.
All that good stuff.
Get your flu shots.
Get your flu shots. Get your COVID vaccinations. Get everything you need to keep your health and your immune system running at 100%. 110% actually.
But you know what, real quick, I want to say for some people they're not comfortable with shots.
True.
But they're still willing to do it, but they're like, well, what else do I do? But there's like things that you can regularly eat, things that you can regularly do that just like help with your immune system that cost like little to no dollars at all. So just like certain things around this time of year, like vitamin C is a major thing.
I was just gonna say
zinc
vitamin D, and when this is a key tip for you guys. Whenever you guys ingest zinc, whether you have it by itself in an emergency pack, make sure you have some form of vegetable or fruit to release the nutrients and the zinc into your metabolism. I'll say that again. Fruit or veggies with your zinc to release the zinc nutrients. Yes. So
it's a lot of options, you know.
You got to think the conversations that we're having at this table here are conversations we very often bring directly to the community. You know, these are conversations and information we want people to know. And these are just, those are just some of the intentional things our team and our organization does as a whole to bring this relevant information to the community in which we serve. So,
Exactly.
you know,
Yes.
the Heist team is working, we're grinding.
Let's do it. I think we're going into
let's do self-intros.
Self-intros now?
You start off. Give us a little bit about Mrs. Shackelford.
I feel like you need a theme song.
Yeah.
Hey. I'm coming in hot.
I'm coming in hot.
Yeah.
Okay, we'll start off that way. What's your walk-in song? Yeah,
That's a real song. That's Andy Mineo.
Yeah.
What's the bounce they be doing on TikTok?
Oh, well, hold on. That one has a lot of curse words.
Yeah, so I just had to
Not safe for work. All
right, let me get into my introduction here. My name is Kaylon Shackelford. I am a community health navigator with GRAAHI. I'm coming up on my year here in January, I think, right? Ooh, that's happened really fast.
It went fast.
Time flies.
I can imagine when I was hired in under Ashley's wing, we were working alongside Taylor Bays, she's now at the University of Columbia, doing a wonderful job there. It's about coming out a year now. From Muskegon, Michigan. Came out to Grand Rapids about 2018. Started working for GRAAHI. No, I came to Grand Rapids 2020. Started working for GRAAHI in 2021. Time flies, y'all. That's my introduction. It's kind of like taking me back right now. I ain't really thought about it until now. So it's been a pleasure, though. So
But he's had a heart for people and serving with this organization anyway.
Yeah.
Because he actually was like volunteering and working with us on projects before he was
exactly.
hired.
6-7 months before I was volunteering.
I remember that.
Yeah, he was like, whatever it is you need. So like he helped me drop a U-Haul and all kind of stuff for one of our major events.
GRAAHI's got a thing for working on the hottest days.
Yeah. In the summertime. And the coldest. At this point, and the coldest. Like, I was just saying this, sorry to cut off the self-intros, but man, it's like these GRAAHI events that we do are literally just like Mother Nature's like, we're going to test these people.
Hello.
To see how willing they are to
stay willpower
what's their determination looking like. And man, they really test and try.
We're going into the strong
like
soldiers.
I swear, like the most extreme weather conditions happen every time we do an event.
It still comes out
but it happens
really well.
And people still show up, people still have a great time. Weather is not going to be a determinant for people to show up. Obviously, unless it's dangerous out, stay inside, check your tires, change your oil. But no, it doesn't matter. Like, if the event's good, it's good. People are showing up. We're doing great.
Hello.
Follow our social medias at GRAAHI, Instagram, Facebook, all that good stuff. You'll see a lot of social recaps. Yeah, pictures, fun stuff, media. Yeah, media.
This guy. We're going to get to your introduction next.
Virginia.
Go ahead.
Well, hello, everyone. I'm Virginia Walton, and I'm the Community Resource Advocate. I started with the organization in May. In my background, I worked as a social worker with the Department of Human Services. So I was been a social worker for most of my life,
Awesome.
as a matter of fact. I work with a program called Children's Special Health Care Services as well. I spent 19 years with that program, which is such an awesome program dealing with young people that have special needs.
Awesome. So a long background of serving. It makes a lot of sense. I understood I definitely knew a lot of your professional background prior to this, but I didn't know that, to be honest. I knew you were working for the government, all that good stuff for the state.
And I knew her passion was with the youth. 'Cause
Yeah.
I'm telling y'all, if there's anything that we doing, the youth, y'all are represented
Yes.
by this woman, right?
That is what I
Yes.
was called to do. I didn't know that at
Awesome.
first, but
That's amazing.
I do know now I was called to work with young people.
That's
And
amazing.
that's where I've spent over 30-some years. I started out just fulfilling a need.
Right.
And then it wasn't long before I realized that this was my calling.
She started. So let's stop right there for a second because y'all know how I am about
I'm ready to
words.
dive deep.
So she said she started off filling a need,
Fulfilling a need.
and in fulfilling her need, she found purpose.
Yes.
So the whole thing that I heard out of that is the thing that I need to do is often the thing I'm called to do. Like
Yes.
that's what I heard from what she
Yes.
just said.
Right. Yeah, that's
And
exactly
what
what
God
she
has
said.
for you, is for you. Because I didn't know this was a path. When I graduated college, after I did my student teaching, I said, "There's no way." Seriously,
You got a little taste of it, huh?
I walked
He said,
away from it. No.
I'm good.
Quick disclaimer for those that are called to be teachers, we salute you.
We
that
need
was not
y'all.
her
No, we need
bag.
y'all. No, you are the most important.
Okay.
Protect your teachers at all costs.
But after my student teaching, I was thinking, no, this is not what I want to do, is work with young people. But it ended up being my calling. I love it. I have my passion for it, and I love my young people.
Yeah.
But she just teaches in a different way.
Yes.
It's so fluent. It's organic.
She's boots on the ground. Like she
Oh,
does
yeah.
not care.
She doesn't.
She's like, give me the trenches. I got you.
Yeah.
There's not anything that's going to stop her. That's what I've seen so far.
Oh,
And
no.
she
Wow.
outside because you ask Virginia what's going on in the city. She'll tell you every event, who hosting it, who cooking at the event. You know what I'm saying? Who bringing what dishes?
She knows the dietary
If you want to
restrictions
go,
at
here's
this
the
point.
way you can go. It's like she's the plug into any event that you want to go to. Virginia, how we get there, who we got to talk to, and she'll run you that list real quick. So
There's Virginia Walton.
extreme
One and
resource.
only.
It's been a pleasure working with you, and we're going to continue to do great things together. So
I met such an awesome group of young people that are really hard workers. I work with young people, some of them, that slack off, that I guess not what they want to do.
Give it to
But
us straight.
This
Yeah, I was
group
gonna
of
say.
young people that's here, I told Vanessa that I've never seen such hardworking young people in all my life.
Oh wow.
Seriously.
Aww.
Seriously.
Well, are we considered young still?
Like, my
Listen.
bones is talking
Yeah, exactly.
to
I
me.
was like, my back.
Listen, y'all don't get to think you old
My
when
bad.
we older than you. So stop
I'm old
it.
enough to
I know,
be
but
all
we
y'all
wanna-
mama.
That's true. Man, y'all spirits be making y'all seem younger than me sometimes.
Yeah, that's for real. That's for real. Well,
This is a perfect segue as we talk about some of the positive energies and spirits, because we've been missing one of our North Star, I'm gonna call her, our team's North Star, for the last 3 months due to medical leave, but now she is back. She is
Yes.
slowly, and we're gonna put an emphasis
Slay.
on slowly, because we know, our directors are watching.
yeah, seriously.
We're not having her work today. Okay, she volunteered, but no, we're happy to have you back. She's a pillar within our pillars of succeeding as a team and organization. And I'm going to introduce you. I know you're going to introduce yourself, but I'm going to do it formally.
Ah, look at him
The
coming
wonderful-
in clutch.
Does he remember her title though? Is that the?
What is it? What is it? She's my boss, big sister. She is somebody that I'm calling in crisis. So she's my triage emergency team. But more so, I'll let you introduce your title now that you came back.
So I am Ashlie Jones, and I serve as the Health Initiative and Community Engagement Manager. So that is indeed a mouthful, but ultimately, I'm just called to serve and undergird. So like I cover my team and I undergird them. That's what I do. So as crazy as the idea is, I'm like, yeah, let's do it. And as safe as the idea is, I'm like, nah, let's think bigger. So for the most part, I really enjoy serving with our team. Like we really have had some changes within the organization and within the team directly, but they've all been good changes in my opinion. I've been with the organization since 2019. I transitioned from the Grand Rapids Chamber of Commerce. So I was there for about 7-ish years, and then came here. So now, what is this? 3 years I've been here. Time don't wait on nobody.
Nobody.
Sheesh.
You ain't lying.
But I really enjoy what I do. Like our team is really, really dope, and I trust their genius. And I'm always looking for ways to position myself to serve them, but serve the person first. I care more about who you guys are versus what you do, because if your who is broken, then your do is broken, and I can't in good conscience hope that we can serve the community, and I can't serve y'all. So that's me
real.
in a nutshell.
That's real.
And I appreciate.
Awesome.
Yeah, I was gonna say perfectly put.
But really quick, even though Darcy King is not here,
Yes.
Darcy is a wonderful addition to our team. She's the newer kid on the block, we'll say. So she's been here, 3 months now?
Yep.
She actually started just before my surgery. So she has definitely been kind of like learning the ropes. And I think that also speaks to the strength of this particular team for us to have a new team member come in. And those that were already here and in place and operating and moving in such grace, they were able to guide her and teach her and help her get acclimated to her responsibilities and her role in my absence. So I think that that's so important. You know, you never want to be the person that has all the answers. So I'm grateful that our team was able to do that. So Darcy King, she is one of our community health navigators, and she's doing great work. We're setting her up for something tremendous here for 2023. And each individual person on our team will have an area of focus, and we'll kind of get to that a little bit later. But for those of you that have not had a chance to meet Darcy, she will, if not already, is available on the website. So like email her and say hi and start to tap into her genius. She brings quite a bit of experience.
100%.
And then another time we'll be able to like include her where she can kind of like talk about her who and her what, because she's very, very, very passionate about a very specific area of work, but we won't give away all the goodies because
you got to meet her.
Yeah, and y'all got to watch the podcast, and you got to share, and you got to
100%.
like, and you got to tag somebody.
Exactly.
Hello. We didn't pay her to say that either. Well, I guess we are paying her to say that.
Well,
we got the introductions out the way. I want to go around the table.
oh, appreciate it, man.
Well, hold on.
I'm just playing. I was just playing. Okay, so let me tell you why. Let me tell you why this is so funny, right? Because this guy in our friend group outside of work is the troll of everybody. He's the master troll. Respectfully, though.
Respectfully.
So I had to get him on that one. I never forgot about you, bro.
I appreciate that.
Go ahead.
Hello, viewers. As you've already seen my face a couple times, my name's Calvin Wynn. I am also a community health navigator on the Heist team. I also do a lot of the media coordination and stuff like that. Not in the title, but I do a lot of the media stuff, obviously the podcast and all that good stuff. So all the magic you see on the screen, gold fingers.
This guy here.
Michigan State alum. 27. Wow. Almost at the wrong age. Michigan State alum, 27 years old. Grand Rapids, born and raised. Love the city. Love everything about the city. Grand Rapids, Michigan.
I honestly could say you live this city. You probably know every square inch crevice of this place.
I could probably draw the city freehand. I'm overtly like proud of being here and calling this my home. So like just wear it on my sleeve, let people know that. And like I feel like it's been very common for people to lose their love of their hometowns, but like I feel like there's so much to love about this place and the people. Don't get me wrong, I love so many other different places and I want to continue to see the rest of the world, but right now Grand Rapids it feels so warm. And I just feel I feel so warmly embraced. Yeah. Not today. It's like sub.
That ain't green screen out there.
Yeah, it's not green screen. I'm not that good at editing.
That's real snow, people.
I'm not that good at
Watching this in
editing.
Cali, Texas.
But yeah, nonetheless, like that's what I'm saying. Grand Rapids just feels home. It's just been a place that I've called home for so long, and all the experiences I've had here has made me who I am today. So that's why I kind of represent Grand Rapids so much, because I feel like it's a visual representation, a geographical representation of who I am as a person. So
That's dope.
yeah, I feel like everyone knows each other a little more after that conversation, or at least the viewers.
Yeah, the viewers.
We know each other pretty well, I'd say. But at least the viewers know us a little bit better, kind of our backgrounds, all that good stuff. Let's dive into what our team kind of even handles. You know, from this conversation, me and you are kind of just flies in the wall. To start off, we'll obviously chime in a little bit, but the sunshine is on these two.
Yeah.
So
I know 2022 is kind of what we're covering with all the departments here. Ashlie, you are our kind of captain with getting that year started for us. So kind of walk us through 2022 and, you know, some of the goals and our perspective as a heist team and organization in 2022.
So 2022 was still filled with a lot of COVID.
yeah.
Yes.
Yeah.
It's funny how we are now at the end of the year and people are still talking about it, but they like treat it like a cold because there's been so many other things that have come along, right? We have had many strains of COVID and monkeypox and RSV and
Yeah, keeps going.
right. So there's just been a lot of things, but at the top of 2022, we launched into a major vaccination campaign. We were really working really hard through some funding that we received through a specific grant that was afforded to us by way of Spectrum Health and
MSU, I believe.
Yeah. And it was actually the first time that we as an organization had to take on something of this magnitude. There were somewhat 20 plus partners that we were able to from different sectors of the community that represented different arms and legs of the community for us to help to inform our community specifically. It wasn't just for persons of color, but it was mainly directed towards the African American community because unfortunately they were saying that, hey, they're not getting vaccinated, they're not interested, they're not this, they're not that. So we as community partners were able to come together and say, okay, we know that our community members, they need this. We are the people that serve them, but we also serve their entire need, the unspoken needs, right? So everything launched in January. We were able to do like a huge event with the it was actually Martin Luther King Day.
It was the Brown Hutchinson.
Yeah, we partnered with Brown Hutchinson. They were one of our Brown Hutchinson Ministries was one of our locations, and out of that we were able to kind of hit the ground running. We had multiple stationary clinics. So like Baxter Community Center, we were able to work with Brown Hutchinson Ministries. We were able to even branch out into the school system. Yeah. So Kentwood Public Schools, they were able to come alongside us. And
library.
Yeah, Brookwood Elementary, Wyoming Library. Yeah. We were able to partner with U of M Health West, Catherine's. Let me think who else, Cherry Health. So it really gave us an opportunity to educate our community on what COVID was, and then also provide them with vaccination opportunities so they were able to make informed decisions. And as the different vaccinations became available, we made those available to the public. We were also able to give them a safe space to come. A lot of people were doing it scared, right? So we were willing to do whatever it took. And it didn't matter if you were an adult and you needed me to hold your hand, I was there. If you were a little person, because I don't like calling kids little people to me, because little people grow up to be great people.
100%.
So I really believe in it. And some came and they were excited because they felt strong and empowered. And as a result of the kids coming, sometimes their parents came, right?
Yeah. Right. Yes.
So the fearlessness of the child brought the parent, and it created coverage and unity. And it was just all these wonderful things. And we've done blood drives and all kind of things. So we started off the top of the year with myself and Taylor Bays. We did speak briefly of her. We miss her. She is probably one of the dopest people ever, and I want you guys to remember her name because she is going to change history. Like she's phenomenal.
Yes. She's effortlessly intelligent. I don't know if this is the right way to say it, but that's how I'm gonna say it. Describe my sister, because she's so smart,
but
she can have the chillest conversation with you, and then in the conversation you can ask her a complex question and she will recall what the CDC put out last week. She'll recall a case study that's happened. Verbatim too.
Brilliant mind.
Shout out to Taylor.
Brilliant. So as we previously stated, she's currently in she's in New York. She's at Columbia University and she is working on her master's degree, and the opportunity came and she was like, this is what I think I'm gonna do. We were like, forget think, go ahead. Come on, I need you to go be Black Magic on display, okay?
Exactly.
So
let us know if you need anything.
We are so very, very proud of her, but she was instrumental in the infancy of the work that we were doing and helping to align everything. And then along the way, we were able to pick up the genius of Kaylon. So myself, Kaylon, and Taylor, we were like hitting it hard. And it really gave us an opportunity to work with organizations in a different way, right? We were able to work with the Divine Nine. We were able to work with healthcare systems. We were able to work with community partners, you know, like
Greek organizations.
Oh, yeah.
The Grand Rapids Black Nurses Association was a huge component. And just a huge resource.
And let's park there for a second, because they believed so much in the work that we were doing, and they believed so much in the community that they were willing to do whatever it took to get shots in the arm. So if that meant that somebody needed to pull up and get the shot in their arm and sit in the car in front of a building, like they were willing to do that. And it did not, again, to your previous point, Calvin, it did not matter about the weather, because we wanted our community to know that we cared enough to be where they are. Forget having to come where we were. You have to meet the people where they are. So that's why we were intentional about setting up vaccination sites throughout the city. And every single one was off of a bus line, right? So we provided a day, a time, a location, you know, an opportunity. There were a couple of times, if my memory serves me correct, that we were able to partner with Uber. And we're able to provide free rides. And, you know, we were really, really able to just kind of rally around our community. Did we solve the crisis of COVID? No. Did we give it a kick in the butt? Heck yeah. And we could only have done that with the help of, number one, this team here, but then also our CEO as visionary trusting us, right? She was able to cast vision and say, okay, this is how we do it. And then the creativity amongst our team, we were able to develop meaningful ways to impact the community in a major way and show up in places and spaces that you wouldn't expect to see us. Case in point, when we partnered with the NAACP and we did the comedy show. That was a vaccination opportunity.
100%.
And people got vaccinated. People like it happened.
Because I think the biggest question I get, like when I'm going to different meetings in the healthcare communities, volunteer communities, nonprofit communities, and they're asking, you know, how you guys engage. I didn't know that before I got here, right? But it goes back to kind of the things that I guess I was kind of raised on, but more so taught here. We're going to where the people are at, but then we're asking questions.
And even if they only came out of curiosity, right? That's okay. I'll take it. Because if you were curious, that means you thought about it, which means you were aware. So if for no other reason, let me just see what they in here doing. And we did have some people. And sometimes the information that you get from those that you serve, or just from a person in general, does not always come from a survey. Let me tell you something. I am a full-time employee. I serve full-time at a ministry, and I'm a full-time mama. I do not have time to be writing no doggone check a box here. I hate. This is me personally, okay? I hate excessive surveys. They're stupid. One or two questions I can hop, like that's cool. I can do it. Meyer is very strategic in how they do it, right? It's one question. And when you check out and self checkout, was the store clean? Yes or no? Did you find what you need? Yes or no?
Yes.
Were the people kind? Yes or no? So you've been punching in your stuff while you're paying. You just figure like, this is one more thing I got to do to get out of here, not knowing that they're gathering. So it's very strategic. It's very, very smart. But then also too, there are other ways to do it when you are serving a community that has other needs, right? If I am facing a home crisis or food crisis, or I've got these other things, a health crisis, a survey is not always the best way. It does work. I'm not saying that they don't work at all. And my rant about hating them is my own personal, right? That's not a representation of GRAAHI. That's completely Ashlie.
Right.
But I think that those conversations that we were able to have with people while they were waiting for those 15 minutes or so, or coming in and we're coaching them in and we're just being present, like that's how you find out what a person needs. Have a conversation.
Yes, definitely.
Because here's the thing
Yes.
about time. It is the
Yes.
only currency that you can't get back.
100%.
But it's the most important.
100%.
It's so important.
The most valuable.
It's most valuable, right? Time is a currency that you don't get more of. So I have a very important job of making sure that the time you spend with me is of value. Because if I disrespect your time, that means that I don't have a problem disrespecting you.
That's right.
100%.
Okay.
That's right.
Yeah.
So we have to make it very intentional. And that was some of the guidance around how we were able to move into some of these other opportunities, right? It started off with COVID and we started having conversations. We started learning about the people and their
Yep.
needs.
People asking for more.
And
different
then
ways.
it just like the floodgates,
Skyrocketed, yes.
right?
It
It just
did.
burst
Skyrocketed.
open. So that's how we started really digging into having things like community conversations and partnering with other locations and things like that. You know, partnering with Tabernacle Church and with Princeton CRC and places like that, because now we're having conversations about, I have gotten my COVID shot, but what do I do about my diabetes?
Right.
Right.
What do I do about hypertension?
Right.
I heard that if, you know, my grandmama had it, does that mean that I can? What are some other ways? Like it starts, you know, you start having these other conversations, you know, hey, I'm a single mom and my
Right.
kid had to be at home for a whole school year. What do I do? How do
Right.
I help them?
Right.
Do you know about tutoring programs? Do you know? So like mental health started becoming all
Big
these
issue.
things.
Yes.
Yes.
You ain't lying. And I think that's
Yes.
where it's like she layers it. I'm gonna say to you what I got from the survey piece. You can't expect for the work to be done by just issuing out a survey. No matter how good that survey is accumulated, how much data you put together to strategically put it in places it needs to be. If you not in front of our people, if they not hearing you, you know, hearing your tone, listening to what you say, catching you in a vulnerable moment, all those things matter for our community.
Oh,
They
yeah.
have to get a face value, right? Because, and we just got to be real, there's been a lot of times where we have taken things for face value and it's not what it is. And we've trusted it to be that several times and it has not been. So we need reassurance.
But can we
Yes.
park there
That's
for a
what
second?
that's what I lean on and learn.
Oh, absolutely.
You know?
So you used a word that I think is one of the most important words that we as a community, meaning community partners and community residents, vulnerability, right? If I can't be vulnerable with you, how in the world am I going to expect you to be vulnerable with me?
That's right.
Why do you have a reason to trust me?
Yep.
Right? Vulnerability and trust go hand in hand.
Yes.
And let's be honest, a lot of people aren't comfortable in that space
That's right.
because they've never been provided a safe space.
Yep.
So, as those that serve in community engagement, we have to always create a safe space, but it starts with us being vulnerable.
Correct.
Right.
It starts with that vulnerability. I can't pretend that I have all the answers. It's okay for me to say,
I don't know.
I
That's right,
don't know.
You hit on the
It's
nose,
okay.
Virginia.
Yes.
I don't know. But because you matter to me, I will find an
out.
answer.
Yep.
Yes.
100%.
That one person having that little bit of time, like I spoke about, with you, you have now giving them hope. Something that they may not have had when they walked through the door.
Yeah.
Yep. And a
So,
resource to call on.
Right.
You didn't even
To
know
let
you
them
was
know,
that.
And
too,
it-
that you care. That
For real.
someone cares.
Yes. Because
Be it.
who does not want to belong to a village?
That's right.
Okay.
Yes.
So GRAAHI in its totality, I believe that we have been given a very special gift. The gift to serve, number one, a gift to be vulnerable, and a gift to create and sustain community. Right?
Yes.
And the value of the village. Like if COVID taught us nothing else, it taught us that we need each other.
Yes.
100%. For the reasons
Dang
that
right.
we stand on, right? To be able to get optimal care, right? To be able to advocate, which means if you go to an event and you're talking to people that look like you and they're giving you information that you can take back home to your family and friends, you are now an advocate now. No matter what the capacity is, you are an advocate because you have information that can help somebody help themselves, right? And then going into that research piece, you know, if we are talking with you and learning what the community needs, we're taking research there. We're meeting with some of the healthcare professionals in the community that look like us, that do not look like us. We're gathering a holistic picture, the negatives and the positives in the picture painting, and then educating. That's important.
It's extremely important.
huge.
And then what it does is it gives, how do I want to say this? It gives an opportunity to ask the necessary question to find the necessary solution. So which camera is it? This camera? Okay. I want to make sure that the people that are watching and hearing this podcast know that you are the solution to a problem.
Yep.
You are the solution to a problem.
Yep.
I'm going to say it again.
You
are the solution to a problem.
100%.
The only way that you can find out what that problem is by asking questions. If that means asking the neighbor questions, asking your leader questions, asking yourself questions, but you are the solution to a problem. So we at GRAAHI, we look to commune with the community at large and talk with and break bread and provide safe spaces so that we can ask the necessary questions, so that we can find out what those problems are that we're called to solve.
Yep.
And throughout the year, we've been able to do it in many different ways. And I'm just so very, very proud of our team at large. And then also, too, you know, more intimately, our Heights team, because we've really been able to kind of shake up some things, you know, like this podcast was birthed out of it.
This definitely was, because we was realizing, and I guess I had to back up. So January, we started our clinics. We had 4 clinics, 4 different locations that were going on every month for, I believe it was about 4 hours each clinic on different days throughout the week. And going through that, I think it was around like the summertime where we knew that our impact was good. Right.
Sure did.
But there was a huge space that we weren't sitting in, that a large part of our population was sitting in. And that was a social media podcast, like forum platform, right?
Yeah. A different way to provide
Information,
Right.
and putting us out there,
right, the health
making us
literacy.
visible in the community.
And then also, too, I kind of want to back up for a second. As we were transitioning into the summer space, that's when we were able to get both Calvin and Virginia, right? It became something different then.
It did.
Because now our team is larger.
Yeah.
And like we previously stated, like Virginia knows everything about what's going on.
She does. She really does.
And we were able to, what you say, nosy? No, my grandmama call it inquisitive.
Inquisitive.
But
That's a good way to describe
But we used to be like, dang, grandma nosy.
it. Yeah. No, for sure.
Yeah. And I think also too, it, you know, like Kaylon previously mentioned about being where the people are and them seeing our faces, right? Virginia,
And forming a relationship.
right, there it is. There it
Forming a
is.
relationship, and they'll be more willing to trust you in making decisions.
Yeah.
When you're out there, you know.
And we found that to be true
Yes,
because
very much so.
people ask you questions. Like they see you and they know you represent the organization and then the kids, right?
Exactly.
They trust her.
Yeah,
Yes.
they do.
They trust her. So I think that definitely has been, you know, we kind of quickly surmised some of the work that we've done, and we didn't touch on all of the points because it was so much. Because there were so many different times that we were able to show up in community, you know, Rock the Block when we did the event, Swim 1922 with the SG Row, and, you know, other places that we've been able to show up and really just, you know, provide information, provide opportunity, provide access to resources, provide needs, right? We've done food, we've done masks, we've done household needs. We've done raffle. We've done all kind of things.
Warming kits.
Yes.
Comfort kits.
Yes.
Yeah, we try to do it all under the sun.
Yes.
And one thing I want to chime into as well is just the volume that we were doing a lot of these things. And, during the height of all these initiatives, we're running COVID and the vaccination clinics, and that was a big initiative for us. There was a lot of people that showed up. There was a lot of people that got vaccinated. We did a great thing in terms of just the sheer numbers and just our accessibility. But, as we started to shift farther and farther away from the heightened version of COVID, participation slows down a little bit. But what really kicked it into gear for me is just, even though our participation was lower towards the end of these vaccination clinics and even towards the end of this year, the ability for us to even be there and just the accessibility, no matter what, we were still there. We were still there for our 4 hours. Our partners were there. Our providers were there to administer these shots. But it was nice knowing that if someone came in, they would see a smiling face and they would see a helping hand held out for them.
And even the evolution of that, right? As the urgency around COVID started to seemingly wane, we were able to start to look at some of the important pieces around what some of those other needs were, right?
Yes.
So those same locations that we were focusing on having the clinics then open their doors for us to do other things. For example, Princeton CRC, right? Yep. We were able to do diabetes workshops there. We were able to do immunization information, right? As kids were going back to school and things like that. There were so many valuable pieces to it of the partnership, and those partnerships will continue to carry over into 2023 because our focuses as a organization will remain, connected to our pillars, right? For anyone that's not familiar with the pillars yet of GRAAHI, it is, it's community, it's advocacy, it's research, it's education, which, obviously it forms care. Yeah. But how can you care for a people that you don't know?
Exactly.
So we have been intentional about getting to know our community. So we'll see all of that kind of continue to trickle over into 2023 as we're focusing specifically on, very, very intentional places and spaces where we'll provide not only information and education opportunities, but life application, right? Curriculums being built.
Right. Yep.
Teaching opportunities and measurable goals, not just for the organization, not just for the department itself, but measurable goals for persons that are a part of the community that are taking the information and they can take this home and then they can start to see transformation happen. And I want to stop there for a second. Not change, but transformation. Yep. Okay. Seasons change. So you already know if it was summer once, it's going to be summer again. If it was winter once, it's going to be winter again. Seasons change, but transformation, that's permanence, right? A caterpillar would never be a butterfly
and then go back.
Right?
Yes, that's true. Yes.
It's never going to happen.
That's crazy. I was thinking of that whole analogy metaphor in my head as you were saying it, because that's real.
Yeah, I was
right? It doesn't change back.
It's never like, man, I'm straight on flying.
Right.
Good. This is too high.
Seasons change. People transform.
There it is.
Bada bing, bada boom.
And it's so important because
That's fire.
as you commit to transformation, it's going to always be this thing that happens because it becomes a way of life. So if you are transforming how you eat today, it becomes a way of life of how your children do it tomorrow.
Yes.
Right? If we commit to transforming community, it'll become a way of life. It might be hard for us breaking down barriers and systemically coming against things that are they're not fair. They're not just. There's no equity in it. But if we do the hard thing now, right, on the other side of the thing you won't do is the thing that you want, right?
Yes.
So as a team, I feel like we're committed to the work of the transformation. So I kind of want to pivot a little bit, if it's okay.
Yeah.
I wanted to kind of talk to Virginia a little bit. I want her to kind of give us a little bit of the good stuff that's coming. If you'll kind of share with everybody specifically what you're going to be focused on for 23. I'm excited.
Okay, my focus for 23 is kidney disease and cancer, lung and breast cancer. That's my focus. And I'm also really, really, really excited about our youth council. Because as you have figured out by now, I love the young people, and they are going to bring a lot to the table. And I love when we had our first meeting with them, I took 4 of them home. And if you guys could have heard the conversation that they had about the council, it just blew my mind. It was like, wow, I was just in awe of them. They're really excited about it. They really are.
Transformation on
Hello,
display.
to be a part of something. I'm sure, no, because I remember probably getting them there was a whole different story,
A whole different
I done been
story.
that kid too, like, I don't want to go. Then I get there, my light get to shine, and I start talking, so that's a wonderful thing that you all have been doing.
And I also have
Iryonna
another group of young people that I put together that help me canvas. In this group, they're all African American males. I have 2 middle schoolers and 3 high schoolers. And they be calling me, Miss Virginia, when we going out again? And they like being out there in the community and talking to people, and we passing out flyers. And I've had a connection with a lot of the area churches, some African American community churches where I go. I have a person there that I go to and give the flyers to and let them connect with them. Yes,
that's good.
So even though she's not here to talk about it in detail, but I'm looking forward to 2023 and seeing some of the wonderful work that Darcy's going to do around sickle cell.
Yes.
She has a very personal connection to that, and we're very, very excited about the amount of information, the wealth of knowledge that she'll bring that'll help guide the work that we do, because when you're personally connected to a thing, it's easier to be able to give guidance in a space versus us as a team trying to figure out, right?
Exactly.
Not only has she had to endure what the transformation of such a thing looks like, but the onset of the change.
100%.
The two go hand in hand in that particular place, right? So she's able to speak to it intelligently in such a wonderful way.
On a personal level that gets you intrigued on like a way of how can I help? Like what can I do to make that a feeling that no mom or dad, or anybody has to feel in that situation. I want to give her flowers. Calvin and Virginia have been working alongside of me as well. She's already hit the ground running when it comes to developing different tools for the community. And one of them is a sickle cell journal that she's worked with alongside of the Davenport nursing program. And we've all chimed in, but we gave Darcy the opportunity to take this on because of her wealth of knowledge. And she developed a journal that allows new mothers or parents with a child with sickle cell to be able to identify, ask questions, know what different tests are and their likelihood of success, treatment plans, to be able to document what medications are being taken. There is even a tips of advocacy piece in this journal to where you can know what questions to think about, like how is this impacting me financially? How is this impacting my relationships with my family? And then when you go into the doctor's office, being able to ask specific questions and show a pattern. Because one thing we realize is when you're in it, you're going to so many appointments, and you're trying to remember so much, but then also carry information back into the doctor's office. And there are things getting missed that's impacting a person with sickle cell. So she worked hard on that. So
in this case specifically, ignorance is not bliss. So
correct.
Her trying to literally just eliminate all the spookies involved with like going into a doctor's office and having to advocate not only for yourself but for your child.
Right.
Your child.
For
Who
your
can't even
child.
speak. The most, who can't
But
even
even
speak.
sometimes you're advocating for your unborn child.
Exactly. Yes.
Because that's a whole thing in itself. When there are certain markers at play, when there are certain things to consider, like this child is being advocated for by mom who does not necessarily know.
No, and rightfully so, in a sense, like you don't know until that's now in front of your face.
And you don't know what you don't know.
No, but you want to know now. I ain't gonna lie, when they bring it to you, I'm sure as a mom or dad, you want all the information that you can get right now, right? But unfortunately, the way we set up as humans, there's only so much you can retain in moments. So I want to give Darcy her flowers and a kudos because she hit the ground running. Those there's actually a presentation that's involved too that GRAAHI will be able to release to you guys in the early parts of 2023. So that's something to look forward to. And I just want to give that out.
Yeah, absolutely.
Yeah, and just a huge shout out to the Davenport Nursing Program. Rebecca there for helping us out. Darcy, very integral in that process, and it's awesome.
And that's why work like that is so important when we partner that with, say, a blood drive, right? At the beginning of the year, there's another opportunity for us to, have people come out. We'll be hosting a blood drive at Brown Hutcherson. And that is a crisis, right? In the Black community, we don't have enough people that are donating blood. So if you are African American and you have sickle cell, you may have to have transfusions. If there's no blood, then what? Right. So, just a quick plug.
It is.
We are looking forward to seeing your faces at the blood drive. We are looking forward to making sure that you have all of the information. So if you regularly donate, please consider donating with us. Please schedule an appointment. If there are those that are within your sphere of influence, encourage them to come. We'll have additional information, available for that coming out. So you can find it on our website and regularly watch our website, because January won't be the only time. We'll regularly have blood donating opportunities because it's necessary.
100%.
That's one thing that you can do to help your community
and be a part of that transformative process.
Right. It's an opportunity for us to help us.
Yes.
Out there.
Can you say that again?
Yeah. It's an opportunity for us to help us.
One more time for the people in the back.
And that's a fact. I'm gonna be clear. We donate too. I mean, even here at the organization, we are not the type of individuals that we wouldn't do. Like, you may come in and not even know that I work for GRAAHI. Well, you do now, but right? But hypothetically, if you were at past donations or you're coming in the future, you may see me in a bed right next to you donating, because we truly believe in these things. This isn't something that,
and believe it or not, this was
we have to do, right?
Was my first time donating. When I started with GRAAHI, I had never donated before.
Wow.
And this was my first time.
Transformation.
From the inside out.
Transformation. That's amazing. That's amazing.
That's good.
Man. So, Kaylon, what are you cooking up for 23?
Man, my chef's hat is on a little bit.
But wait, pause. Can we talk about your hat for a second?
Oh, yeah.
Community highlight.
Community highlight. Shout out to, this goes out to Juwan Laudermill, one of the founder and CEO of Everybody's Great. It's a nonprofit out of Muskegon. This is their merch material. They're focused on giving back to the community via scholarships. So they have different merch, from sweatsuits. I know he's going to have some sweatsuits dropping, but this is a limited edition hat that was distressed by himself, Himothy.
Wow.
Check me out.
Personally distressed hat.
Let's get it.
Listen, so we real quick just wanted to kind of kind of talk about that, because let me tell you the power of the black dollar.
Man,
but that's a whole different podcast.
Hello. Stop playing with us. We're gonna be branching out. You know what you call them, spinoffs.
So congratulations to him.
Yes.
And if you are in the market for apparel, we already know where to get it from.
Check them out.
I'll put the link somewhere.
Yep. We'll show them some love. We'll plug it.
What they do in the video? Like, follow the link up here or down here.
Yeah, it's somewhere on this video, right? I'm gonna dive in. So my focuses are diabetes and heart disease. So for anybody that does not know me, I'm very open. I was diagnosed with heart disease in 2017. So I have a very rare form of heart disease, acute rheumatic fever. So for me, it's very important to let people know that you have to be intentional when it comes to your health, even if it's with heart disease at all ages. That can impact everybody. And that just comes from knowing your history with your family, and being very in tune with what your body needs. And then being able to build on that with a primary care physician that you trust. So, yes, for heart disease, that's my focus. And diabetes is also my focus. If my mom's open with this, she's a diabetic right now, a new diabetic. So it hits home for me to be able to create different things that people will be able to take home and share with their families. So what I've also worked with is the same thing Darcy kind of put together. We were able to put together alongside you all the diabetic tips presentation and journal. So for my mom or anybody else that has diabetes, they'll be able to download this journal and know how to identify, treat, and use the equipment if you are diabetic. And then also know how to track your medications and what tips to advocate for yourself and what questions to ask while you're in the doctor's office. Because sometimes diabetes can go into remission through lifestyle changes, through eating right, doing daily exercise, 30 minutes a day. You can prevent diabetes. Sometimes it is hereditary, but ultimately it's my goal to hopefully create a cookbook that is tailored directly for our people, right? Because we love to eat. Right?
Yes.
My mom, that was the biggest change for her to change her whole diet, right? But to make recipes we like to eat anyway, right? But then be able to track those with people that have diabetes and see where their levels change.
So I'm gonna challenge you because I'm big on words. So I need you to swap that hope out for something a little more firm.
So what we're gonna do is we are going to
Bingo.
That's why y'all see why she is who she is. I said that earlier. Put some respect on it, right? What we're going to do though is effect change, right? And be able to do that through this cookbook, and that's going to bring down the levels or hopefully put people's diabetes in remission. And they won't have it. So that's what I'm doing on the diabetes side. As far as heart, it's all about awareness for me. So being able to bring in healthcare professionals that look like us and speak through some of the things that you can do to prevent heart disease or identify if you are at a higher chance of getting heart disease through your past family history, and knowing what resources to get that information from, and then how to act on it as soon as possible. So just trying to hit it from multiple ends here. And I'm blessed with the opportunity, honestly. So that's what my 2023 kind of looks like. Now, I want to get to my good brethren here, Calvin Nguyen.
Hello.
Right?
Yes.
Love that.
See how I said that name perfectly. But I've been practicing.
He has.
All morning. I've
had
in
to
the
catch him
mirror.
a couple times.
Yes. But anyway, Calvin joined our team probably August? January? July?
Full time. I've been working with the company since like March-ish.
March-ish, right?
Doing some contract
Because he
work.
started like full time, and it was the very next day was like rock the block.
It was rock the block.
literally.
Been hitting the ground running. So
Haven't stopped since. My feet have been moving since.
we have to give him a huge kudos because he's been able to beef up our awareness in the community through digital presence. He does all of our editing here for the podcast. He puts out all of our promotional content. So all the recap videos, all of the promotion videos, anything that has to get edited, kind of put onto a screen, he's doing. So kudos to you. You've came in and have killed it since you have started. And on top of all of that work, he is doing everything that we're doing. So he's really a blessed mind. And I want him to kind of get into what he's been doing here and what he plans on doing on the podcast side and on the Health Heist team side. So let us know, brother.
All right.
Talk to me nice.
Spotlight. No, no, I appreciate that intro, man. That's awesome. Obviously, very thankful and grateful to be here on such a great team. We do so much work, and 2023 is going to be electric.
Hello.
I like that.
Electric. We're gonna.
PR capabilities.
Yeah, exactly. I wrote a few emails in my daytime.
That felt good to me.
This is Calvin every day.
But no, nonetheless, my focus this year on the health programming side is a big look on HIV/AIDS. That's my emphasis, responsibility, and really what we're going to do is work with the community. We want to be hand in hand with community leaders, programs, organizations to break down the stigmas associated with HIV/AIDS, safe testing, safe practice, all that good stuff, and just be more knowledgeable, more intentional. A lot of this information and a lot of the disparities we've seen in testing, treatment comes directly from our health equity index. Shout out to Andre Ivy. That information really breaks down the numbers, the statistics for us, and really why it's important for us to even have an emphasis on this on this topic. And the reason why we are working so hand in hand and with other organizations in 2023 is because we want to be as educated as possible. We want to be as in the know as possible. We want to actually know and feel what the community is feeling and really getting a good pulse. That relationship will drive more impact in terms of how our events are set up, how we plan things, the informational material we put out into the community, all that. So we're just having a better grasp and pulse of what the community actually needs, and then working hand in hand with these other programs, these community leaders to facilitate and make the changes and the impact and the transformations that we want to see. So that's really our big initiative for HIV/AIDS in 2023. I will dive a little bit into our podcast and some of the media initiatives we're looking into. Obviously, this podcast will be the greatest podcast that you've ever listened to.
Yes, sir.
Health initiatives, come on. Let's just set the expectations right. No.
I mean, why would you want to listen to anything else?
Why would you want to listen?
I don't know why I keep going back to this TikTok. Don't play with it. Don't play with it. Don't play with it.
But no, truly though, we want this podcast to be as informational, as entertaining, and as digestible as possible. We want the community to not only have a safe space at our events, but a safe place to listen to information that they can use in their daily lives, information that can transform. I keep going back to the word transform because it is such a beautiful way to describe things, but we want to transform with our community in the comfort of their own homes, in the comfort of their vehicle on their way to their 1 hour commute. You can hear me and Kaylon babble in your ear for the next hour while you drive to work. Who doesn't?
Might as well. I mean, it's going to be some little
little
nuggets in there because one thing that he's doing when it comes to his health focuses is the numbers are there. People are dying, right?
Yes.
On the back end, we do know that African American population is the least tested, right? Yes. But we are the least informed through the powers of technology and also hopefully having a hand in the community, right?
I'm going to back you up. Where we going? Words have life.
So I'm going to say this. What we are going to do is partner with you guys in the community to educate you so that way you can get in front of the information and make a knowledgeable decision and then pass it to your neighbor and then keep copying that, kind of like the shampoo, right? Wash, rinse and repeat.
Yeah.
And then what happens is when you look up over time, we are now representing ourselves in the testing phase, which is then a byproduct that is less deaths from this topic, right?
Yeah.
We do know some things are not preventable, but through information, which we will get to you.
Yeah.
We're not going to hide from you. We're going to get to you. Calvin's going to package this. We're going to be there to support him. But we're going to drive those numbers down. They're going to go down this year in Kent County.
And it's so important because, let's be honest, gone are the days of us not having these kind of conversations with our children.
Yep.
Right. Yes.
Okay. I am a mother. I have a 21-year-old son, an 18-year-old son, and a 14-year-old daughter. And doggone it, you better believe that we've had this in several conversations and will continue to, because how can I effectively mother them if I'm afraid to inform them? Why would I let the streets teach my children something that could more than likely be misinformation? It could be
100%.
wrong, right?
It's going to be their friends. It's going to be somebody they same age
or just the internet.
That don't know.
The internet, right? Gone are the days.
With the proper education, this is something that is totally preventable.
Exactly. Exactly.
It's preventable.
So we have to take our head out of the sand.
Yes.
We have to have the necessary conversations. But what has been, effective as a mother is having the necessary conversations, with the correct information.
Yes.
I shouldn't only have access to it because I work for such a dope organization. Right. There are going to be some young people that are not going to listen to me. It doesn't matter how young I look. It doesn't matter how many tats I got. It doesn't matter how dope my nails are. Like, they don't care. No. I'm somebody's mama.
Right.
But my daughter is having conversations in text threads with her girls,
Mm-hmm.
I need to make sure that she got the right information.
Yes.
Because her
Definitely.
friend may not be comfortable going to her mother,
Yep.
Exactly.
Right.
but she might be comfortable coming
Going
to
to-
Ash.
Right.
And that's happening, y'all. Like this ain't
Yes.
no hypothetical. What she
This is
talking
a
about?
real thing.
It's not a hypo.
Yes.
Don't think that it's not happening. Don't think that the children, the youth, is not seeking this information.
Don't ever say my
Just because
child
it's
would
not
never.
just because it's not coming to you. You know what I'm saying? That's
Definitely.
Because before we quick to be like, oh, my kid would never remember who you were when you were your kid's
Hello.
age. Okay, but I'm gonna leave that there.
Yeah. But nonetheless, curated conversations is all about having conversations that you either can't have with a professional for whatever underlying reasons or don't want to have. And we'll have it for you. You know, me and Kaylon and plenty of others. We won't be the only host on the show for the duration of this. Ashley, Virginia, Miguel, Darcy, who knows, who cares? You know, it's
Any one of the
GRAAHI.
faces,
Anyone here is going to give you valuable content. But nonetheless,
I love that he said it's GRAAHI.
it's GRAAHI.
Come on
You know,
now.
come on now. That name speaks for itself. An acronym that will, far live the test of time. But nonetheless, these are conversations we want to have with you guys. We want you to join the table with us. You know, you're sitting here. You might not have a mic. You might not have a pair of headphones, but
you're hearing
you know what I'm saying. You're hearing it. No.
You have a voice.
All jokes aside, exactly. We want you to be at the table with us while we're having these impactful and meaningful conversations with our hosts, our guests, all in lieu of making this information accessible to you. So
we here. Another good day here at GRAAHI. We have a exciting guest here to talk about another pillar or department of the Grand Rapids African American Health Institute. With me, you guys already know this familiar face here, Calvin and Kaylon Shackelford, both community health navigators. But today we have the luxury of speaking with a real presence in the community. We have Miss Iryonna Davis, and she is our public policy fellow / leader of our community engagement / outreach. Iryonna, thank you for coming today.
Thank you for having me.
How was that drive? We know it's cold out there.
It wasn't. I slid like once.
You did.
That was doing good.
You
for
know
me.
what? That's good.
Yes.
That's good. No curbs, right?
No, no
All right,
curve. Well, you know what?
maybe yesterday.
My bad. I ain't gonna
We're
ask
talking
that.
today. We're talking today.
Didn't nobody see it on camera.
Well, it's good to have you in. I love working with you. I'm excited for the people to know all the great work that you've done. But first, we want to get a glimpse of Iryonna Davis and the community of Grand Rapids. Walk us through kind of, what you're already doing here in Grand Rapids. Just tell us a little bit about Iryonna.
Let's backtrack. Yeah, I was gonna say let's backtrack a little bit. Just tell us about you.
Yeah. Where you
Not
from?
even about what you're doing, just you.
You.
Yes.
What are your hobbies? What do you like
Kids,
to do? Yeah.
married.
I am. Yes. So I am married of 1 year.
Hey.
Yes, I have 2 beautiful children and 2 stepchildren.
Oh, that's lovely.
I am a person of passion for people.
Mm-hmm.
I realized that very early on, which has really guided me through my career path. I am a very, very big spiritual believer.
That's good.
And so with that, I try to make sure I'm intentional as possible. But overall, the things that I like to do is I like to make money for one.
Hello.
Who doesn't?
You
right?
okay?
Yep.
Let me be real with y'all right now. Don't believe that you don't need no money.
Yeah.
It take money to eat. It take money to survive and support your people.
Yes.
So it is no selfish or greedy thing to
Don't
say.
get
Yes.
me wrong.
I like money.
that
And, I always have to add that because when people talk to me like, oh my God, you're so great and you help people and you do this and da-da-da-da. And I'm like, yep, I'm all of those things. But I also know that it takes money to do certain things.
Sure.
And so I desire to have one day a certain level of wealth so that I can continuously pour into the community and other people, but also be as sustainable as possible for myself and for my offspring.
Right. No, that's a good way of saying it. Do you think that also goes into a part of knowing your value too? Like going through, and we're going to get into some of the things that you've been able to cultivate here in the community so far. But throughout all those processes, were you developing the value that you're, kind of asking for in these rooms and, what you're able to do now? Like, was it a value development type?
It was. I think that before you can go anywhere in life, you have to understand the value of yourself before you can be valued to others. So I know that I have a lot of people who are inspired by me. I know for my children who pay attention to me daily, anyone that's connected to me, it's important that I place value on them so that I always have to make sure that my value systems are corrected and are in check. Yeah. And so before I even became probably anything to anyone from the outside, I had to make sure that I was good. And so I had to build my foundation on my belief system and what I thought was true, so that at the end of the day, no matter what I go through, I can always check myself, right? Because you experience so many things. People can hold you into certain standards, but the real reality is you have to be able to be that for yourself. Because if you're not, then you find yourself being the ways of other people. You lose yourself in the process.
Staying authentic.
Yes, absolutely. Being
keeping yourself accountable to you.
Yes,
for sure.
Yes.
That's important. I'm glad you shared that message, because that's the type of person that is representing GRAAHI too.
Yes.
You know what I mean? We are a byproduct of the things that you've worked so hard on creating for yourself and your family.
Yes.
So we appreciate you.
Thank you. I appreciate you guys.
Yes. So alongside being a wife and a mother, we know you're doing some things on the professional side as well. What are some of the things you were doing prior to, coming onto the GRAAHI staff? How long have you been with us so far?
Yeah, so it'll be 9 months.
9 months went by fast, huh?
Fresh crew. There's quite a few people here, like under a year. A year under, which is awesome.
It went really quick. Yeah.
We gel well for us to be all like as new as we are. Everybody's pretty open to each other. We have everybody kind of talks to each other outside of work for the most part. We're comfortable, so that's good. What are you doing professionally? I know you have a organization that you are currently the CEO of.
I am. So I am the CEO and founder of Meaning in Colors, which is a nonprofit organization that focuses on self-empowerment and sustainability. We are really big on financial literacy, as well as teaching both youth and adults how to navigate through different systems that have been barriers in the past. So a large part of our programming is our transitional housing, where we allow people to come and stay there. They pay a set fee, and then we help them in those different areas of finances and life skills, so that when they're ready to transition from us into their own traditional housing, they're equipped with the tools and resources that they need to be able to sustain. And then our mentoring is our second largest part of our organization, and that's where we have several programs for our youth, all around what it's like to identify themselves and all about self-worth.
Really?
It's amazing to see the kids just aspire to be certain things, but then learning about themselves and then being able to teach them those things that aren't taught traditionally in a school system, or things that I wasn't exposed to as a young girl. That is very important in today, to be able to really reach your full potential, or be able to reach a level of sustainability that requires you to be able to just soar, right? Because there's just so many things systematically that
put you
has
in
been
a box.
And
I don't want to cut you off, but I kind of felt that, it definitely puts you in a box you don't even realize you're in, until it gets to the point where you have to make hard decisions and you're not equipped with the education.
Tools, just like
tools,
everything you need,
tools.
really. For sure.
So how long have you been doing that so far?
7 years.
7.
So yes, we started off, it really was a vision. I was literally, one day we'll talk about the personal testimony what led me to it, but started with one transitional house with 5 men, because at that time, single men, there was nothing in place to help them. Again, systems where usually for single mothers or mother with children, and even just women in general, there's a lot more programs that was out there. And so there's a lot of men who made simple mistakes that are paying for it for years, whether it's something criminally that's affecting them, something that they're, on their credit, or they just, the lack of education of not knowing what it takes to be able to rent or even own a home, right? And so there's no book on that transition and what that looks like, or becoming a young man to an adult. And so I found that the need and the request, all of the emails I was receiving was from men and just needing a place. They were working, but living under bridges. They were working, but they were living in hotels. Yeah, I mean,
that's wild.
Yeah, so
Sheesh.
it started, and so we got that one, and so then we just expanded. Here we are, 7 years later. We have 6 of them.
Oh wow.
Yeah. So right, and
putting in the groundwork, huh?
Right. Yeah.
Okay.
Yeah. It's crazy to see it now.
I like that.
It's crazy. As I was walking in today, I received a call from a guy who just completed his prison sentence, and so reached out about housing, and so. It's a never-ending need.
Yeah,
truly.
And so we have to make sure as a community that we're doing our part to provide these resources because, people make mistakes.
They do
and
all
so,
the time,
yeah.
and they need it because it trickles down to so many dynamics, from family dynamics, social, obviously financial, housing, right? So many social determinants. We can't even talk about access to healthcare because if you don't have benefits, right?
Yeah.
You don't even
But
think about it.
Never-ending list.
Yeah.
Never-ending list. It's crazy.
So for you to be there as a conduit to facilitate change for them, I want to take our hats off to you, and that's commendable. It really
seriously.
is.
The passion-driven leader you are for your
promise.
organization has only carried over and brought inspiration and obviously results in good work to GRAAHI.
Yes.
We're so happy and thankful for you to be on board. And this is a good transition into, some of the duties and responsibilities you have here at GRAAHI and how that kind of piles into 2023 and even what we were already been doing this year.
Yes, and so I'm excited about the work that I'm doing for GRAAHI. To name a few things, for 2023, we have already started our youth council, which was very, 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 very lengthy process because we wanted to be intentional. And so in the beginning, advocacy work, especially in the community, has not been something that has been traditionally done, especially in inner city school systems, right? We talk about it. We have student government, but the real action, the groundwork of actually knowing what it's like to be involved in community work, seeing what it's like to look at candidates as we just went through an election and, knowing who are these candidates and how do we get involved in their local officials and how
it plays a role into your everyday life.
Our laws, and from driving to our school systems, to the things we pay in for taxes, that all plays a huge part. And so as we're making these laws and things are changing, it's typically going to affect our youth one day. And so we're making decisions for them. And so when our CEO, Vanessa, came to me and she was like, we need to make sure we're empowering the youth and making sure that they have this voice to be able to know the process so that when they're of age, right, they're able to really know what that system, that process looks like. Right. And so that it can be something generationally changing, right, or transformationally changing.
I agree. And you're shortening that learning curve because it's like, even for me, like getting involved to make decisions voting, I ain't gonna lie. When it got time for me to vote, like I was so uneducated. Like I had no idea about the governing system. I'm like,
you start from scratch, start Googling.
Like my voice is not gonna, I'm like, my voice is not gonna get heard.
It's like
because I don't know what I'm even doing.
And then you don't feel empowered because you know nothing, right?
You don't know nothing.
Exactly. You know nothing. And so
none of my friends is talking about it either. So I agree.
So that's the thing. And so, but yet it affects us, right?
Exactly.
When you're going down the street and you see this extra bike lane and you like, bro, like you're right here, right?
Yeah.
And it's like, when did they do that? Not that it's a bad or good thing, but it's just like it exists.
Yeah,
and what happened? Well, that all came from us voting, right? Or whoever vote that's making, these decisions. And so even down to like right now, we're dealing with situations with a lot of schools closing that's in the community. Well, what does that look like for gentrification of people, kiddos walking their neighborhoods and seeing boarded up schools? Or what are they going to do with these schools? And what happens when you're able to walk down the street and you no longer can? That all affects our children. And so, when we don't know and our children don't know, we don't know who we're voting for, like you said. And so we have to give that back to them. We have to give them back that voice. We have to have an understanding that advocacy looks different on different levels. And one part of that is a part of governance. And so I'm excited to learn with them. I have already been doing a lot of outreach, trying to see who's the best people to connect with. And I'm learning that there are so many organizations who does this work on educating. Yes.
How many kids? So how many kids are in this program right
So
now?
right now we have 13.
Wow,
Oh, it's amazing.
What's
Yes.
is there a goal to get more, or
It
is that kind of a
is.
good starting point right
That's
now?
our good starting point. We wanted to get a core group that we can work with, we can learn, and then begin to add as the years go on.
Okay.
But we didn't want it to be something where we're all learning and it's just the group is just so big that there's no real focus.
Yeah.
And so we wanted to start with a smaller number, and it's great because the kids are from different areas, different backgrounds. They all attend different schools. So even in our first couple meetings, it's amazing to just see the different voices that they have. Like we have one young lady who she attends the aviation school, and she's already flying planes, and she's
How old
a
is she?
sophomore in high school. Yeah, it's crazy.
That's
And so
crazy.
she brings this different
Yeah.
side, and to just hear her speak, and then our kids from Ottawa that's involved in sports, and like there are things that they've been addressing, and our kids from Kentwood is just amazing to just see. They're all around the same age, but they're all experiencing different things, and
Right.
so when we get to the root, we've been really homing into like what are some issues that they see that's existing that they would like to see change. And although they're from all of these different areas, they all have the same issues.
Really? What are some of those
Yeah.
things that they bringing up?
A
Like
lot
just
of
a
them.
few of them.
Yeah, so some of the things they talked about is violence that's happening right around them. Switch coding, right? So how do you be black in white spaces, which is very similar to what a lot of adults experience. A lot of young ladies are talked about their hair textures and how they're always being questioned about what is this and what is that, or if they choose to wear weaves, can someone touch it, down to being in certain spaces, and because they're not acting what you consider black, you're not black
You're
enough.
not black enough.
And so
You go around the white people, then you're not being so-called proper enough,
Yes.
formal enough. Then you go around your people, and you're not being down. We're
Yes.
just gonna use layman's terms,
Yes.
down enough, right?
Yep.
So y'all creating a safe space for them to. They're getting a layer of things. Here, bro. Like peer-to-peer counseling,
Yes.
in a sense.
Yeah, no, and this I just want to bring back like the conversation we had with Stacey, and like just watching his students grow the confidence to advocate for themselves. And
Yes.
that's the beautiful process in between that. So
Yes.
yeah, no, the youth council is amazing.
So Iryonna, if there's a kid that's seeing this or a parent that's seeing this and they're looking to have their kid, interact with the youth council or become a part of the youth council for GRAAHI, how do they go about that?
Yeah, so they can go and visit us on our social media. GRAAHI is African American Health Institute, and then you can also visit us on the GRAAHI website. There is a tab that you can directly go to Youth Council, and you just send us an email, and so we will follow up and get in contact and let you know when there's going to be upcoming elections. The next time it will be a formal election process, just so again they get that full understanding of what it looks like to be involved in government.
Okay, great.
That's amazing.
What do the requirements kind of look like? A soft.
So we are specifically looking at high school.
Okay.
Okay,
Yes.
great.
Gotcha. So
Yes.
grade wise, 9 through 12, you
Yes.
can inquire, and we urge you to inquire.
Yes,
Every
absolutely.
voice is needed.
do.
I know Iryonna spent a lot of time alongside with some of our other coworkers getting this thing together. So I'm looking to see where y'all take this in 2023.
Yeah,
I'm
It's gonna be
excited to
exciting.
meet the youth council. Like I want to meet them.
yes,
It's
yes.
so cool seeing like younger people sparked up.
Yes.
It's such a
Yeah, that's reassuring on my end.
for sure.
Yes.
I think so 2023 we got the youth council. Going back into your 2022, you're busy.
Oh yeah.
He was real busy. You done
Understatement.
did a lot.
Busy is
But
understatement.
I didn't realize how many connections she has, because it seems like in our Wednesday meetings we had, when it was on Wednesdays, right?
Yeah.
Like I wouldn't see Iryonna a lot, but then she's coming to the table and she's got like a list of people that she's been talking to, things that she's running, from our health fair that we had recently
Yes.
to Birthright Circle, I believe it is.
Yes.
We're going to talk about both of those.
Yes.
She know people.
2022. It was a busy year. I'm gonna say, as far as the Rhythm Health Fair, When when I originally came into GRAAHI, that was my very first project that I worked on with Deanna, and we really wanted to make sure that we were intentional this year. And so I sat with Vanessa and we looked at what happened last year. I kind of talked to some of the people in the community and kind of asked, when you thought about the Rhythm Health Fair, because this is something annually that we do, what come to mind? What things did you like seeing? What things that you didn't like seeing? And so I got the voice from a lot of people. So just going from the list, I started reaching out to a lot of organizations and just getting their feedback, making sure that what was going to be represented at this health fair was going to be people who were intentional about their programming and really changing the culture and making sure that they were going to be a great resource.
Right.
And so from that, I literally started created a whole vision of who I wanted to be able to, that could be for financial education. So I reached out to banks, people that I knew in that industry. I started looking at, of course, the hospitals and the partnerships that we already had, right? And so a big one that I really loved was the Betty Ford mammogram bus
came out.
Yes, came out, right? And it was so awesome because prior to talking with her, we were really looking because they were offering free mammograms. But the real treasure for me was learning about the organization a little bit more. And so we started to dive in about other different diseases that exist, like the different cancers and the prevention, right? And so talking to the nurse, she just explained to me how many things, or how the lack of knowledge that we don't know hinders us. And then in our community, we don't focus on prevention, right? And she was like, do you know if you see this and that, that's a sign of this type of cancer? And I'm like,
just
why
that
don't
quick.
no one I can identify that. And
that's
so
that community connection that you building, because you brought them out too. Was it Martin Luther King? That's what we had it at, right? Martin Luther King Park. And I remember seeing that bus out there. So it's like, it ain't like we are trying to tell people like, hey, this resource exists. You can go see them when you have time on over here, wherever they located. Took the time out to coordinate to bring them to the people.
Yes.
Exactly.
And it was crazy because I told her, I said, I know we're here for mammograms, but you make sure your team gives out all of this information about prevention and what that looks like, because we don't have enough of those conversations. And so just by learning what I did, we were probably on the phone for 45 minutes. I'm like, I could save somebody's life.
No, for real.
That's how I felt.
Hey, you just want to start a group chat with your family and friends. Like, hey, y'all.
Yes. Like, do you know if you know it looks like this? And so that's what it's about, though, right? Bringing that level of experts to the room, right? That's what that's how you show up for your community, right? You learn a resource and then you provide the resource. And so that's exactly what they did. And I'm looking forward to them being at the 2023 one. You know, we've already are in our communication about what that looks like. Another one with our COVID shots, right? And so we focus on vaccines a lot. That's something that I know your team
we were able to like partner with you and
Yeah.
actually, just provide it with the plethora of other resources that was out there. I actually want to know, just on account of like how many vendors you had, but you allowed us the opportunity to come in as the heist team and say, hey, we do have flu shots, vaccinations available for you too. It was very well thought out. I was a part of it, and it would.
And you emceed it, the bomb.
Yeah, you emceed.
Yes.
You did great.
Yes.
The boy captured all the content.
Yes,
so
and the
video that you see
It's on YouTube.
is this cat right here. You know what I'm saying? So I think that's the beauty of this everybody in the
this
room.
a full
the team,
circle. This a full circle podcast right here.
What time of year usually is the walk? And then what's like the overall purpose? Like if you have a person on the street and they're like, what's the Rhythm Health Fair? Like what is it about for them?
Yes. So the Rhythm Health Fair so it's two parts, right? So it's the fair and then there's the run. This past year we had the walk. We really want to be able to provide resources to the community all around health disparities, because we're all about health equity. We want to make sure that they know what that looks like. So we want to make sure we're doing our part in bringing all of those health professionals. We're bringing financial education. We're bringing the community out. So the dancers, right? Because that's big for us. Exercise is big. That's one way that you stay healthy. And so anything that really ties into health equity, right? Because there's a lot of social determinants. And so
100%.
we need to make sure that we're not just looking looking at that. When you look at health equity, you have to look at housing, right? Why? Because if you don't have housing, how do you even get to
the
healthcare? You don't.
part.
You don't,
True.
right? And so bringing private landlords or listings of private landlords, and so people can know that there's going to be resources that exist solely for them to do better
in life, like
And-
optimize
yes.
it. And that's what, and we don't want it to be misconstrued as, it's for you to just think of your health as simply going in to see the doctor or somebody
Yeah,
just
it's not-
offering
it's
you
not that trivial.
vitamins
Yes.
or just talking on a surface level of
Yeah,
health,
there's not like the red pill, blue pill, like
Yeah.
one final answer for everything. We are trying as an organization, we are trying to limit those barriers for people and try and make it as simple as possible, make it
Yes.
as easy as possible, because we know it's not easy.
I agree. That was well thought out because y'all, how many vendors do you think you pulled together?
I think it was around 43.
Yeah.
Yes.
Yeah. I remember because I moved all those tables.
It
was 43.
It was 43.
Exactly.
I'm just kidding.
But no, that's just a testament that you have 43 different resources
Oh.
that all can push you towards a better lifestyle for you and your family that is sitting right there in the community, and you can interact with each one of those tables. We had food available too, right?
We did, yes. And so that was another awesome thing. We were able to provide a free meal.
Mm-hmm.
And then also all the vendors had some sort of something
Like
that
a
they gave
takeaway
out.
item.
Yes. So
giveaways.
you
I
could have
seen bicycles, all that.
What?
Yeah, no,
we
this is
had
awesome
someone,
stuff.
yes, who awesome, and it was important for me. It was a black entrepreneur who had just recently started his business, and so he literally purchased all of these bikes and baskets that he gave away, even down to the raffles that we provided. I mean, this wasn't just no simple,
No,
quick little
it
thing. We
wasn't.
had air fryers, vacuums, gift cards.
Yep.
So many people. We were so thankful for our sponsors and people who donated and really showed up for us, because all of those things went to all of our guests, and it was all free.
It was.
Yeah,
All
it
free.
was.
Yeah.
It was.
I seen a lot of smiling faces out there, from the babies to the parents. We even
Yes.
had a little youth,
Oh,
little
yeah,
activities section for the children
Yes.
too going on.
Yep.
And it's an all day thing. Is this generally around the same time of year? Usually it falls within that August time
it's like
period, though,
August.
going into
Definitely
like end of
gonna be
summer.
August.
Got
Yes.
you. So it cools off a little bit.
Yes.
That's nice. That's nice.
Yes.
Nice. Wow.
Yes,
I like
it's
it.
We're
coming,
actually
it's
doing like
coming.
important stuff and whatnot.
All right.
Crazy.
Yeah, kind of
Yes.
feel good.
But,
But,
no, that's like, I think the health fair is just one example of some of the community outreach and the community engagement that Iryonna is so heavily involved with and leads. What should the community take away from these events in terms of why we're doing it? And then what do we take away from the events? What does an organization take away from these events?
Yes. So what I would say the community takes away is knowing that there is an organization that exists for them to try to remove these barriers. An organization that is there to be able to give you resources that not only you just see, but you can be able to utilize it, right? It's important to know that things exist, but it's even better when you're able to use them. And so I think that is what GRAAHI is for the community. We are really doing intentional work. We're trying to show up in different ways, right? We're solution based. And I think that's what's important for people to know when they look at GRAAHI, is that we're not just here to give you a pamphlet and say, nope,
Yeah.
this is what this is. No, this is what it looks like, right? Even down to when we have our facilitators, to the work we're doing in the school systems, everything is like hands on, right? And then we have such amazing staff that at any time, anyone can come up to us. I think our presence is very unique, right? No matter the level skill sets that we have, what our education background is, we're very open, right? And so that's important for people to know, let me put this person to the side. I may have an additional question.
Right.
And so I just think that the community can know that no matter what, when you look at GRAAHI, we are literally here, and we are going to work as much as we can to help position the community as it relates to health equity and all of the things that comes along with it.
For somebody that's interested in these things that you're doing already, how do they get engaged? They want to be a volunteer or be a participant?
Yes, you definitely want to stay connected to GRAAHI on all social medias, and you definitely want to check our website. We literally post everything there when it comes to signups and submission. Everything is going to come through the GRAAHI website. So, as well as the Facebook. So if you're on Facebook, you're going to see those posts, and it's coming. It's coming.
Got you.
You'll be seeing one fairly soon. So definitely
Just
tap
reach
in.
out then. Huh?
Yeah,
You could DM us, right? You can DM us on
Yeah.
IG.
Yes.
You could DM us on Facebook. Iryonna will get the the message, and
Yes.
she'll be able to follow up with you and get you going. On my end, if there's anybody out there in the community that wants to engage with GRAAHI, to further what they're doing, partner with or align with kind of what we're doing, feel free to reach out with us. You can also get the opportunity to be a part of the Rhythm Health Fair this year, right?
Yep.
And get in contact with us early. Iryonna's your gal. We do appreciate you for coming on and showing
for
your
having
face.
me.
You're always in the
Yeah.
background taking care of so much. You need to come to the forefront. You know what I'm saying?
Yes.
So we
I
appreciate you.
guys.
Thank you.
Thank you so much.
We out. Let's cut.
We out.